Good morning, Nancy. Good morning, David. Good morning, everybody joining the HITLAB April Symposium for 2025. The symposium today is going to be all about breaking barriers by using digital technologies to improve access, reduce cost, and improve quality. My name is Stan Kishnowski, and I am the chair of HITLAB, and I will be helping you navigate this exciting day of activity. A little bit about the agenda today. It's kicking off at 11 o'clock and then going through 2 p.m. We are going to be talking with a whole host of people that are using digital to do exactly this. Starting off with what's happening in reproductive health, when we'll be talking to folks from the Planned Parenthood and how they're using digital to help improve not only reproductive health rights, but also patient care and patient access. And then we will be moving straight to 11:15 with reimagining memory care and talking about how different multisensory engagements are helping with connections. Toward the top of the hour at 11:50, we'll be having a discussion with Doug Goldstein from Medcurio about what this company is doing to help improve access, reduce costs, and improve quality. And then going into our second hour, you guys are going to hear from a whole host of other leaders, including Bill Toronto, talking with Neil Weinstock from a company called Solid here in New York City that's helping develop goggles that'll help blind people see again. And it's actually working. This is not a piece of vapor. And then in the third hour, we've got an exciting last hour to carry you through, including Amy's going to be talking to folks from Recovery Plus, the company that's helping people do their rehab at home and seeing extraordinary clinical outcome improvements and also seeing extraordinary price improvements for the ecosystem. So with that, having gone through the agenda, don't forget today to use the chat in Zoom. We are one of the few groups that opens it up because we know our community is well behaved and self-monitored and has all the etiquette in the world to use chat properly. So use it as an opportunity to connect and learn from others, meet other people from around the world. Remember, we are global in our mission, vision, and our goals. And so that's important too. So jumping into the first session, our own Amy West, the principal of advisory services at the HITLAB, talking with Ambreen from Planned Parenthood, and to talk about how they're using digital to improve access and quality. Amy, handing it over to you.
Thanks, Stan, and welcome, Ambreen. I'm really excited to be here today to kick off our April Symposia with you. And I know Stan did a brief introduction, but why don't I hand it over to you to share a bit more about your background and your focus area and why you're here today.
Sure. First of all, thank you, Amy, for inviting me and for letting me be here. There's a lot of amazing speakers, so humbled and honored to be amongst good company. For folks that are not aware of the work that we're doing at Planned Parenthood, I'm Ambreen Molitor. I'm the National Director of Product Innovation at Planned Parenthood, and I've been at the organization for about 7.5 years. And what we have been doing in the past 2 years in the innovation team, historically, we were building in-house products. In the past 2 years, we've actually been really honing in on our partnership arm and really bringing in startups in the pre-seed round to help them actually bring their vision to reality and also integrate it into our tech stack and ecosystem. The opportunity allows us to, co-develop in flexibility and customization. And, we'll talk more about what those companies are, what they do. And then the other arm that we have under innovation is a lot of research around generative AI and thinking about ethical tech and how we can be part of that conversation in a responsible and meaningful way.
Wonderful. We're pleased to have you and appreciate this conversation. So to kind of dive into it, talking about digital health and some of the partnerships and collaborations you mentioned, what are some of the most promising digital health partnerships that you've developed in the maternal and reproductive health space? And what, from your perspective, is making these collaborations effective?
Yeah, great question. So for context, we've worked with around 4 and soon to be 5 partners and startups in the organization. All of them have predominantly focused on the strongest sexual and health, reproductive health inequities in the United States. So that being unintended pregnancies, maternal health. And another thing we're looking into is the increasing STI rates. For me particularly, these partnerships are meaningful in that together we are able to solve for or respond to those health inequities by creating solutions, showing numbers and impact, and having promise indicators that we're making some movement. I think the other thing that makes these startups really meaningful, and I can name 2 just to give like more color to the story, is that they also think about social determinants of health, right? So there's opportunities where we think about socioeconomic status, we think about one's lived experience, and those things really come to fruition in these solutions. So in terms of, socioeconomic status, one startup that we're working with called Autonomy allows patients to match to funds that are readily available on the federal, state, and local level. So if someone wanted to, for instance, obtain an abortion, they are able to connect to services that provide them the funding should they not have it and they want it. And what that really does is provide and decrease that access and barrier to entry for healthcare in general, which is cost. We talk about this a lot, where cost is a big barrier for entry in terms of getting the right healthcare one needs. Another startup that we're working with is called Poppy Seed Health, and they work in the context of providing virtual and in-doula support. And we're actually in a pilot phase with them, which I'm really excited about, really focused on maternal health and focused with the Black community in general, and figuring out ways that we connect with these patients and women and work with them from pregnancy to postpartum and monitor the progress and keep them empowered, educated, proactive, in really understanding their health and bodily autonomy. So those are just some examples of ways that we feel like have been promising, is that we're making meaningful choices where we're looking at the impact that we could potentially bring and looking at the overarching problem and what we want to solve for.
That's great. Those are great examples too of how how you're able to leverage digital to bridge some of these gaps that we have with accessibility and support. So great examples. And so again, and with the partnerships that you're working with, when you're working with the earlier stage startups, that are, again, they're earlier in their development and some of their capacity, what has been your experience in working with some of those startups in the reproductive health space? And as you're working with them and seeing the promise and the potential, how are you tailoring the support that you provide to, to support their needs and vice versa?
Yeah, it's a great question. I will start with providing, what they are doing, what these startups are doing on a pre-seed round. What's really compelling about someone starting at the pre-seed round is that they have a blank slate. They don't have systems that are built in place where, if we were to work with an enterprise, say software, we're actually abiding or, agreeing to like the workflow or a template that they're serving us, versus when we work with startups, both of us have a blank slate and we can draw from that and create a customized approach and something that's more appropriately tailored for us. We're unique in many ways, as one can imagine, in that we're very focused on a particular lane of healthcare, but also we are in a space where there's a lot of opportunities where you have to be aware of policy regulations or things that are someone just needs to be a little bit more mindful of in terms of data and security and things like that. So I think for us, the pro is definitely and certainly the ability to innovate faster, quicker together, right? And I think that comes from also thinking about not only the promising idea, but a really authentic leader. And it really, and I sound like a venture capitalist, but like, and everyone says this, like the secret to a really good organization is someone that is passionate and driven and focused. And I would say the same for like really strong partnerships that we've seen. Some of the strongest partnerships that we have are when we see dedicated, focused, authentic leaders that really understand the problem, either have lived experience through it, and really understand it in a way that we will never. A lot of it is through firsthand experiences themselves, and someone that really understands that and are focused enough to say, like, I understand this problem so much, and I see the vision behind it and solution behind it, that I'm very much willing to like go down that route, regardless of the obstacles that come through. So I think for us, that's sort of like amazing, and sort of like providing us the customization, the innovator, and that sort of perspective we just won't have. What we provide, and the question you asked is vice versa. What we can provide these startups is the ability to make that idea a reality. So as I mentioned, a lot of these folks are, in their pre-seed rounds. And I think what's different than going to an investor is first, when you go to an investor, you seek the funding and then you seek a client. What our partnership brings is the opportunity for, to act as like a client vendor, and you get the funding, plus you already get a case study, and you get the exposure and access to our 600 clinics almost immediately, right? And really understand the diversity of location to patient to, the workflow that people set up in each one of these clinics. So I think for what we could provide is just the access that we have in terms of, the patient and clinics that we have under our organization. I think another thing we're really good at that has been beneficial to a lot of these startups is we're in multiple stages talking about it together. And so that access with partnerships with Planned Parenthood gives them the ability to be on more stages, connect with more people, network. And I think that's been something a lot of startups have said that have been incredibly beneficial, which is like you get the funding and the case study, but you also get to talk about the story together in really meaningful stages and tables that they wouldn't have access to otherwise.
Yeah, I think you hit on a number of key components of need and opportunity for the early stage, where it's really supporting that dynamic leader that has that passion and belief in understanding the problems to solve and is willing to really roll up their sleeves and do it. But then you're providing them with the ability to really generate the evidence that they need through your access to support the fact that they have a viable solution that can be scaled, so it's a great marriage there of opportunity to support each other's missions. Just thinking, in the Planned Parenthood space, taking a slightly different direction in the conversation, as we think about digital health in the Planned Parenthood space, in the digital contraception space, what are you seeing what are you seeing as opportunity? Because this is a sort of a new area of opportunity in contraception. What kind of solutions or collaborations in that area are you seeing? Are you excited to see? And are you doing anything now in this space?
Yeah, I will say I'm very excited about this space because there is truly the sort of pure definition of innovation happening there in terms of, we look at it from a perspective of we're seeing the disparity and then what are the solutions out there. And what we are discovering, particularly in the contraceptive space, is there's a lot of innovation around male contraception, which personally that excites me and the organization because what it allows that conversation to become is not one-sided. It's very democratic. So the choices you all make in terms of, the decisions you're making around your sexual and reproductive health are not one-sided. Now with male contraception, those are choices partnerships can make together, a person can make on their own, and there's levity and opportunity there. I think there's also this aspect openly, with the work that we do with Planned Parenthood, the ability to depoliticize the conversation a little bit too. And I think that is really compelling for us. And finally, not to say it last, but it's certainly not least, I think the innovations that are happening in the male contraceptive space are uniquely innovative. And it goes from anything from, you know, things that we are known and we provide those services for, but new medications, new innovations that are happening in those spaces are really cool to see. And we're very excited to work alongside, you know, researchers around the Male Contraceptive Institute to learn more. So that's something we're in discovery mode for. We're very close to trying to figure out opportunities there, but we're very bullish on it and think it's a very cool a way to innovate, but also think about new opportunities that are very appropriate for Planned Parenthood to be in this particular moment as well.
Well, I think it's another great example of a collaboration to bring forward these truly innovative approaches to a space that has always been sort of, you know, one-sided in many ways on the female side. So that's exciting to hear. And thanks for all the work that you're doing in that space to advance it. You know, as we close out, I wanted to just get your perspective. You know, the work that you're doing is very important, and we have a room full of very smart people that have a passion for the digital health space across many different therapeutic areas and sort of aspects, whether they're from the investor side or the startup founders themselves, or even advocates or other stakeholders in the healthcare ecosystem. From your perspective, what type of support can you recommend that they provide in this space as you're working through your opportunities and the individuals that you're working with? Anything they can do to help out as well?
This is such a great question. And thank you for asking, Amy. I feel like, you know, for our organization, what we bring to the table, as you and I just spoke, is the opportunity to show that their vision is a reality. Because we're a nonprofit, what we can show is a really strong impact story. But I think when it comes to like revenue models or like sort of a for-profit story, that's where, you know, we are very much falling short. So if folks in the audience are from venture capitalists or in the space where you are open to speaking or mentoring with these startups, I'm certain they would be grateful, but we would be grateful as well, because we want these startups to survive and thrive. And we are, as you know, we are working with them, and the opportunities and intent is to work with them long term. But I think, as anyone would understand, if you're working with clients and vendors, you want to expose yourself to more than one client, and how does one do that? And all of those things are not something that we are well equipped to respond to, but would love partnership and opportunity to figure out how all of us together can make that happen for these fantastic innovations that we are supporting and are certain will be greater than the needs of, you know, our 600 clinics and our mission at Planned Parenthood as well.
Well, the good news is we have the chat functionality, and we have a lot of opportunities to connect here. So I would encourage, you know, everybody listening to reach out to Ambreen and just make the connection. You never know what can come out of that. But thank you so much. We could go on for much longer in this conversation, but it's really fascinating the work that you're doing and how technology is changing the Planned Parenthood space. So thanks so much, Ambreen. I look forward to talking with you again, and enjoy the rest of your day. Take care.
Thanks, everyone. Thanks, Amy. Really appreciate it.
You got it.
Bye.
We are touching on all different points of the healthcare innovation system in the United States and around the world. And just a great interview with Ambreen that Amy just put together there, and really appreciate Ambreen's time. Next up, we are lucky to have, again, HITLAB's own Jerry Antamano talking with someone from Memory Lane TV. Again, the CEO, Albin Mayno, and that's just a phenomenal company doing a lot of good work in trying to make sure that what patients are doing will be something that will have a much higher quality experience through their platform. And with that, we'll hand it over to our own Jerry Antamano. Jerry.
Cheers, Dan. Thanks so much. Great to be on the April Symposium with everybody. It's my pleasure to introduce Albin Mayno from Memory Lane TV, one of our finalists for our previous Breakthrough Alliance Challenge, who's going to give us a presentation today. So I do encourage everyone to listen in and make sure you get connected with Albin in the chat. But Albin, I'll hand it over to you.
Thank you very much, Jerry. Thank you, Stan. I really appreciate, and I'm honored to be here with the HITLAB Symposium to talk about Memory Lane TV. So You might detect a slight accent. I'm Franco-American, so I apologize in advance for some of the hiccups in my presentations and in my word. But my name is Alban. I'm the founder and the CEO of Memory Lane TV, and we refer to Memory Lane as the Netflix of dementia, because it's the first specialized streaming platform designed specifically for people living with dementia and Alzheimer's disease and their care partners. And I'm going to try to, in the next 10 to 15 minutes, to be really concise, to show you and talk about our mission, which essentially, as Stan mentioned, is to improve the quality of life for both those living with cognitive impairments and their caregivers through therapeutic media. And I'm going to show you what we've done over the past 10 years. We launched about 2 years ago because of the evolution of technology, but we've been working at this for the past 10 years. I'm a film producer from France, originally moved, and I'm talking to you from Portland, Maine. I'm going to try to share my screen because I'm a visual person, to show you and demonstrate you some of the things that we've done. We're all pretty much aware of the crisis behind the statistics that you're seeing, and I won't spend much time reminding anybody about the importance of what we're doing here. You know, 1 out of 2 of us, even in this symposium, will most likely be affected by dementia in our lifetime, either as a care partner or actually contracting the disease. So it's not so much about if, but more about when. And this is my grandmother, by the way, Rosette. This is the reason behind, Aubreen was saying, it's important to have a story. Like, this is why I dove into this story 10 years ago, because I immediately understood that there was no cure for the disease in itself. And there was many ways in which, over the past 50 years, evidence-based research in multisensory stimulation could actually improve the life of the people living with dementia. So I took a deep dive into it when she was affected, and realized that there was a television for dogs and for cat, dog TV. It's a true thing. And there was nothing for people living with dementia in her condition. And we all know that television is a very important part of our daily activity, or screens in general. But for people living with dementia, and my grandmother, for example, it was very difficult to use really as an entertainment because of 3 things. A, the complex storylines that people cannot follow, leading to a lot of frustration, disturbing news content, and everybody, I think, can relate now how those repeatedly experienced can come as new every time, and the sensory overload. So, for example, in the average care facilities, there are about 6 hours daily that we use television. For home caregivers, TV is the default activity that represents both a significant problem and an opportunity. And instead of continuing to talk for the next minute, I'm going to show you 1-minute film that essentially describes what we've done over the past years. Let me see if you...
Designed to improve the quality of life of people living with memory loss. It is a non-pharmacological digital tool that uses the power of cinematography to positively impact mood, communication, and a sense of well-being for users. Leveraging over 50 years of scientific studies on multisensory stimulation and mind-body medicine, our films were developed and tested in clinical settings. Memory Lane is a simple, cost-effective tool that offers care partners a bit of respite from the daily stress of supporting those with memory loss. Our program allows the viewers and their care partners to engage positively throughout the day, helping to reduce anxiety, depression, agitation, and disorientation. The magic of Memory Lane is the combination of multisensory stimuli intended to evoke positive feelings and new memories in the viewer. When people are engaged with Memory Lane, they feel immersed, focused, and happier.
I'll stop it here because our time is limited today, and continue on unless you have a question for me. But what I want people to understand is that we've developed what we considered is much more than entertainment. It's really a a multi-sensory intervention, a modality essentially that offers what we consider a transformative alternative with over 1,200 films of therapeutic content that are very specifically designed for the people that we're working for and adapted to their cognitive needs. You've seen in the short video that our content is plot-free, essentially. It's positive. There's no distressing imagery or themes. It's very person-centered. We adapt. You profile when you enter in memory lane TV who you're caring for, and it's multisensory. We even use olfactory stimulation. You've seen in the previous slide some of the prestigious research partners that we've had before we actually launched on the market. And some of them you will recognize, but what's important to take out of my presentation today is that it works. It works, and it's important because it reduces the anxiety, the care burden of the care partners, and the positive impact that we have on the overall care for people living with dementia is really important. We're very proud to be with HITLAB as one of our research partners. We're doing a heuristic study. We're distributed in many places all around the world, in the US, and we're working with a company, a gaming company called Tover, that I invite you all to look into, who's present in 16 countries around the world, to really make this even more cinematic, projecting on walls and cushions and everywhere. Our films are designed by essence to follow what the circadian rhythm of the day, and the impact that we have through what that behavioral and multisensory digital intervention really addresses different types of symptoms. I want to take you very quickly. My time is really running short. We only have a few other minutes. So I'm going to leave you with a couple of important elements to take out of what we've done. What we've done is essentially scientifically derived from 50 years of research in the field. We've talked about circadian rhythm restoration. You know that the needs in the morning, in the afternoon, and in the evening is very different based on the people that we're caring for. The sensory activation is also important and different at different times of the day. So we've personalized the content using technology for a really person-centered approach through our media library, through music and video and soundscapes, which allows us to manage a lot of the symptoms associated with the disease. So I will share with all of you some of our research through the white papers that we've done, and allow you to take a deeper dive into memory lane TV. But let me take you one before I leave you with why we call this the Netflix of dementia, to show you our platform. You can see and relate to a very familiar environment. We have two 24/7 channels that follow the circadian rhythm of the day. So for people who do not want to look for specific content, it's very easy to navigate through our linear channel and plot-free content throughout the day. But if you want to adapt it to the people that we're working for, you can navigate over 13 different collections. And you can see here the various collections that we've developed, and understand, by the way you navigate our content, you can adapt it to whoever is watching it, the level of engagement, the time of the day. Sometimes people need to be extremely engaged through sing-alongs and music, again, that we adapt through reminiscence collections, or they need to be more passive and just meditate and dream. Memory lane TV allows to do this. We've measured the attention span of people who are using our programs, which is generally between 10 and 25 minutes. And based out of that, we're going to be able to have different touch points at the end of the day that will either allow the care partner to interact, to redirect the attention, or to manage specific symptoms such as sundowning or anxiety or stress. I'm sure you recognize some of the people that are part of our programming, and you can imagine how specific musical playlists. Oliver Sacks in the 70s talked about the importance of very specific music for people living with dementia and cognitive decline. We have sing-along, we have meditation music, we have content to incentivize appetite. Because when you're affected by dementia or Alzheimer's, you forget that you're hungry. You know that you're suffering, but you don't know why. So 3-4 times a day at meal times, we can show different types of content that will incentivize this appetite. You can travel all around the world through city walks or bike rides. There's a plot-free element, which means non-character driven, always positive to all our content. You can do chair yoga. You can revisit some of the sports that you've done with. And we've focused essentially on culture and diversity as well, because based on your cultural heritage, where you come from, your age, or the person that you're caring for, we need to personalize the content for every viewer. I'll end up on and there's so much to do and to say about what we've done, but what's very centric for this voyage and journey that we are embarking to when you enter in the world of dementia is education and training. So we've decided to make our care partner channel, which is directly directed for care partner themselves, with Keep Us Snow and Naomi Fels, UCLA, some of the most prestigious partner in the field, free for all. So with just your email, you can enter and start learning what's going to happen in this journey of memory lane, of dementia in itself. I wanted to leave just a few minutes for questions, so I'll stop it here and essentially answer any question that you might have with a call for action. We're looking for partners here for distribution partnerships, integration opportunities, research collaborations, such as the one that we're doing with HITLAB, philanthropic initiatives for people who want to make the platform freely available for underserved population. So this is a shout out. We've got and created this incredible platform over the past 10 years, and it needs now to reach the global impact that our mission has done. So please contact us.
No, that's wonderful, Alban. Thanks so much for coming on and sharing Memory Lane TV with us again. It's no surprise that you came in our top 3 of our recent Breakthrough Alliance Challenge out of, I think, 400 applications or so. So, you know, something I think that really resonates with the entire community. There's some really positive comments in the chat for you, and I think some questions as well. So I'd welcome you, as we go into the next speaker, to stick around and answer the questions through the chat that may have come on there. But we really appreciate your time, and it's been really great, I think, working with you during this this study that we've been doing with you, Alban. So thanks so much for coming on.
Thank you, John. Much appreciated.
Wonderful. Well, really great to spend some time with Alban and Memory Lane TV. I'm sure we'll hopefully hear more from them during the current year of 2025 as they continue to develop their solution. And moving on from the Breakthrough Challenge and our startups onto someone who is supporting startups and has been doing so for quite a while. And I've had the pleasure with speaking with Jolene on a previous program, and she's actually done some extra cohort work with HITLAB in the recent weeks as well. But it's my pleasure to welcome Jolene Anderson from Vector Point Ventures once again onto the program. Thanks, Jolene, for being able to spend some time with us. Those that aren't familiar with you in the audience today, I'm sure would love a quick 30-second intro about your vast experience so far in the world of healthcare and helping startups.
Well, it's really an honor to be invited back, Jerry. I'm quite passionate about everything wellness and everything healthcare. And thank you for including the last presentation. My 97-year-old mother is suffering from dementia. So too many of our loved ones are plagued by this disease. Well, I have had a 30-year journey into this, started one of the very first corporate wellness companies. Since then, I've been invested in as an impact investor at Vector Point Ventures, as well as very integrated in education in the angel community. I recently spoke at the Angel Capital Association Summit, and today I have the pleasure of attending Life Science Washington. But as someone who's passionate about moving this Titanic forward, namely the healthcare organizations, so that patients really receive the best standard of care as easily and gracefully as we can, I'm very honored to speak today on a subject near and dear to my heart.
No, wonderful to have you on, Jolene. And you've got such a diverse background across the life sciences, as you mentioned, consumer wellness, and of course, digital health, which is what we're gathered here today to learn about. What do you see as sort of the biggest barriers sort of currently holding back the innovation in digital health? And of course, from an investor's perspective, what's the role of early stage investors in breaking those barriers?
Well, to be quite blunt, given the current research grant funding cuts, access to capital is quite challenging. And there are those of us in the investor community as well that organize events, invest, and we're concerned about how to collaborate as quickly and seamlessly as possible, whether it's just strategic resources, advice, connections to other groups, connections to and opportunities to speak at events like yours. We really need to, it takes a village. We really need to connect. But when I talked last night to one of the leading angel group VCs yesterday at Life Science Washington, we're seeing a lot of investment into tools, digital tools that will enable workflow between the healthcare organization, the patients, and the clinicians. And that really needs to advance quickly. But I do believe that there is a lack of infrastructure in place, whether it's access to broadband in some of our rural communities, as well as just change management practices and even cybersecurity preparedness. So it's a whole host of tools that we need to enable to move us forward in this digital age. And as an investor and as a concerned citizen and a volunteer for over 30 years in nonprofit boards, I can tell you we're all invested in it. And don't think that we can't each individually make a difference. We can.
No, absolutely. Some wise words there, I think, for everybody in our community to certainly take on board. And you've got a really unique perspective, Jolene. You've been both a founder and an investor. And with those specific sort of perspectives and those viewpoints, how do you evaluate whether a digital health startup is really going to be truly transformative and break those barriers versus, just sort of a hyped tech overlay or a broken system?
Well, first of all, every CEO thinks that they have something that will change the world, but the impact really becomes, will it be adopted into practice? Will it be commercialized? Will it become standard of practice at the healthcare organizations? Will patients use the tool? So unless it's used, there's little impact. So that's one of the main deal screening points that we look at. Frankly, have they engaged someone who's an expert, whether it's the CEO or some external advisor or board member who's had the experience of building a company, a digital company, and having that integrated into standard of practice? That's really key. Who's driving the bus into adoption? Some organizations, the really smart ones, are doing impact studies. They're very expensive, but that's really to determine, will this device be used? And that's really the important thing. Can you commercialize, and how quickly will this be adopted into standard of practice? Will it integrate into workflow? Does it require extra time and labor costs for the healthcare organization? Those are all really key factors. So not to discourage people, but if you don't know how to evaluate your company, I suggest that you get involved with an angel organization or an accelerator or something at a university where you can really practice in front of pros who will give you seasoned advice. Sometimes the advice is worth more than the money.
Absolutely, yeah. It's definitely it's definitely a good trade-off in terms of the different types of benefits and stuff, and some really good advice there, especially for the founders that are on our program today. And just to wrap up, Jodie, we always have a limited time on these programs to speak with you, but we'd love to hear about, you know, you having worked at the intersection of wellness, clean tech, and healthcare, how you see, you know, digital health right now sort of evolving to support, of course, treatment, but also holistic preventative care across various different industries and also communities.
Well, I certainly would love to see improvement into measuring the wellness data. So for someone like me who started out that wellness journey 30 years ago, as a patient, we know that different tools, whether it's Tai Chi, yoga, massage, acupuncture, you know, there's a sound healing, there's a huge host of tools, but do we have data to provide the proof that that works? Until that data becomes integrated into standard of practice, we will not see insurers cover that by and large across the US. And that's really important. Even I today, 30 years later, as a patient, am required to pay out of pocket. I look at the ounce of prevention as worth a pound of cure, but we need to provide the data. So if we can't measure it, we can't change it. So there are a number of wellness tech devices that I look at, but I'm looking at something in the neural space. We recently invested into a company called InMedics, and I lead the wellness initiative. And so that will be measuring how stress affects the immune system, and we hope to go on into wellness. That's really, really an important tool. But it's important for all of us to become educated in terms of, you know, heart rate variability. How do we use wellness tools or measure wellness in terms of predicting stroke early on and predicting disease? I think we've got a long ways to go, and it's certainly we're on the right path. But again, data is the holy grail.
Yeah, and I think something we can definitely get behind at HITLAB, seeing as most of our work really does revolve around making sure that there is really good evidence and data out there to support the improvement and the development of all these different technologies, especially with the evolution of these different technologies and stuff. Jolene, thanks so much for coming on and sharing your insights with us as always. Definitely love to continue the conversation offline with you about this, and I'd encourage everybody else in the audience today to connect with Jolene via LinkedIn. I believe we put Jolene's link there to her LinkedIn profile, and there's definitely some encouraging emojis and some wonderful words of encouragement there and agreement with you in the chat as well, Jolene. Thanks so much for coming on today.
Thank you. Have a wonderful day, Jerry. And thank you for everything you're doing.
Great to speak with Jolene there. It is T-minus 11 or 10 days, I think, to our Innovators Summit in New York City, May 6th to 8th, our typical Innovators Summit and conference over 3 days taking place at the Microsoft Tech Center, which is also going to be taking place in the middle of our second New York City Health Innovation Week. There's information in the chat that Sammy has posted in. So do check it out if you are interested in either attending the summit or just getting involved in some of the other events that some of our partners and other organizations within the New York City ecosystem are putting together, all in aid of gathering innovators, investors, buyers, life science companies, and everybody else interested in healthcare innovation in one place, New York City, to connect, network, and discuss some of the most important things that are happening in healthcare innovation right now. So leading us into almost the end of the first hour of our April Digital Health Symposium, we have another returning guest, Richard Hambury, CEO of Sana Health, who you may have seen on the program before, has been developing a really amazing technology around wellness, carrying on from mine and Jolene's conversation just now. Hi, Richard. Thanks for coming on. Really good to have you back on the program again. Those in the audience that aren't familiar with you, we'd love to hear, again, a quick 30-second background on what you're doing, and of course maybe some updates as to what's going on with Sana.
Certainly. Well, the 1992, I had to drive a Jeep off a bridge in the Yemen near the capital Sana'a, hence the company name. That gave me SCI, traumatic brain injury, PTSD, and a nerve damage pain problem that gave me a 5-year life expectancy. I'm still alive and kicking now. That's because the first version of the device fixed my underlying pain problem and completely removed all of the nerve damage pain. The device itself is an audio-visual neuromodulation. Obviously, the first version was laptops, wires, and boxes, but this is the current version. We're getting pulses of light, pulses of sound, generating very specific frequency patterns in the brain, and then using that to treat neuropathic pain, PTSD, basically anything in chronic pain or mental health where there is an underlying autonomic nervous system disruption and where slow wave sleep plays a large part of that equation. So fast forward to where we are now, we have a de novo in front of the FDA for neuropathic pain. That was pivotal data corrected at Mount Sinai. And we have Department of Defense funding for PTSD. We completed a pilot at the VA. The data was so good that the DoD then increased the funding to fund a pivotal. And then the last 2 weeks, they've just increased our funding again because basically as they're shutting down other projects, they had some extra left over to top us up, which was awesome. So yeah, those are the two key things going on in the US, and then in Israel, we're about to start a combination pain and PTSD study in combat injured veterans, and that's because in Israel, 1 in 4 the population currently are having PTSD symptoms. Assuredly higher than that in Gaza, but it's a very, very large problem. And the biggest problem in mental health is the ratio between the number of people who need help and the number of mental health practitioners who are able to help people. So there's a bunch of tech that is doing great jobs at increasing the number of people that each mental health practitioner can help. Lots of things like CBT being delivered via app and by VR, etc. We are going for the stage before that. So as soon as someone gets diagnosed with a pain or mental health problem at a primary physician level, that devices can then be sent to that person. So currently in America, 30% of people are on a prescription psychoactive drug every day. So opioids, benzos, SSRIs, sleep drugs. If you add in all of the other self-medication, the estimates go up as high as 50%, but there's probably a lot of overlap between the prescription and non-prescription. And 85% of that is prescribed at the primary care level. And in the last survey that I saw, where they looked at people's medication regimes and said, okay, if this had been done by a psychiatrist to standard of care, how much of this would have been done the way it has been done? And the answer was 12%. So 30% of Americans taking this active drug, 12% of those being prescribed in a way that would be considered standard of care. This is the scale of the problem. And our aim is someone gets sent one of these, they use it multiple times a day, but primary use is to put themselves to sleep at night. And that then solves the sleep part of the equation, which then hopefully makes every other part of the pain and mental health bit easier. So of the tools in the toolkit that you want to assemble in the future, hopefully we are one of the very first ones that then takes a layer of anxiety, stress, and sleep deprivation out of the problem set, so that then other solutions work more effectively when added on. Does that make sense?
Yeah, no, I see. I mean, look, the potential for, the Sana device in those areas that you mentioned around like PTSD, and of course, as you just said, sleep disorders, that's really fascinating. And I think you may have mentioned some of the sort of other at-home solutions that are sort of non-invasive and sort of shifting the future of healthcare delivery as well. especially when it comes to mental health and pain management. Like, how do you see that sort of evolving as you
I mean,
as you
ultimately, all pain and mental health delivery should be multimodal.
Mm,
It should be, let's find all the different tools in the toolkit that are going to work together to produce the right result at scale. So obviously we're the audio-visual neuromodulation part. The other things in that neuromodulation bucket are the vagal nerve stims, the electrical stims. Those are the sort of neuromodulation alongside us that will scale. And then the next bit of the bucket is the sort of software focused things like cognitive behavioral therapy, delivered via apps and via VR. And if you've got those two, and then you've got whatever drugs are actually producing decent results, that's your third leg of your third tool in the toolkit. And
mm.
then you means that your specialty care, everyone's going into specialty care in much better shape than they are now, which means then a much better use of resources at specialty care. So by the time you're actually speaking to a person, once you come off your wait list, the aim is that you're in much better shape. Or the people who most need that mental health resource are being prioritized. So that's
Yeah.
kind of how I see the bucket of things emerging.
No, that's really interesting. That's a great perspective. And just to wrap up, we always had such a limited time on the program to speak with you, Richard. But of course, your details are in the chat. I'd encourage everyone to check out, the great device that and technology that Richard is developing with Sana. You've got decades of research behind you, including, studies and research sponsored by the Department of Defense and so forth. You're in the midst of a pivotal FDA study and having, of course, received breakthrough designation for fibromyalgia. We'd love to hear from you as we wrap up. What are the key challenges you're facing in bringing this technology to a larger market now, and how you're planning to sort of overcome some of those challenges?
In terms of our risk and challenges where we are now, it's timing. It's timing risks, which is therefore bleeds into funding. The liquidity in our space, there's plenty of money around once you have an FDA approval and enough early sales to show that you've de-risked the commercial route. We're at that stage just before that. So we're in the middle of a safe note extension round. We're trying to raise a total of 5 million. We've closed on 2.7 already, so we're over halfway. That will then give us enough money to complete the FDA, make the first early sales in Israel before we do a Series B, because the FDA, the de novo we've got submitted already, should come through in Q3. The current cuts to the FDA are not impacting de novo timelines, which is really good news for us. The next million basically solves us through the timeline that will get us through to a really big Series B. So the liquidity in the market, and that's the bit that I'm focused on sort of daily wise right now, because clinically we've solved the problems, regulatory wise we've solved the problems, and we're in good shape. It's just a little bit more fuel for to get us over that line.
Yeah, it's always piecemeal, right? In terms of trying to make those steps. Richard, it's always a pleasure speaking with you. Thanks so much for taking the time to be on our program. I'd encourage everybody in the chat to connect with Richard, find out more about Sana. And if you're a founder, definitely talk to Richard about what his journey has been like so far. He's definitely one of the success stories we've had at HITLAB in terms of the progress that you've made, Richard. And I always love hearing your story about how you came up with Sana as well. Thanks so much for coming on.
Thank you, Jerry, and I really appreciate all the work that HITLAB is doing to support me and everyone else in our community. Thank you.
Thanks so much. Wonderful speaking with Richard. I'm going to hand back over to Stan to take us into the last few minutes of our first hour. So Stan, back to you.
Brilliant, Jerry. Really appreciate just a phenomenal interview with Richard. And for those of you who thought the British invasion was a group of 4 rock stars from England in the 1960s, that's all done now. Now the British invasion is Jerry Antamano and Richard Hanbury talking about digital health and talking about how people can take their own experiences and create massive platforms that have tremendous opportunity to change lives around the world. And that's exactly what Richard's doing, and certainly our own Jerry Antamano is doing as well. So we're thrilled to have not only an entrepreneur and a C-suite officer from the company MedCurio, but also someone who is an author whose books, when I was teaching all of the eHealth, mHealth courses at Columbia School of Public Health in the 1990s, was writing a lot of the textbooks I was using in my classrooms. So happy to have Douglas Goldstein from MedCurio join us. Doug, how are you?
I'm fabulous, and it's great to be part of HITLAB. And I just can't believe it took us 25 years to begin working together after publishing the first book globally on e-healthcare and the promise to improve healthcare. Fast forward, it's a pleasure to be able to actually work with you with HITLAB and what you've created here. And it's also a pleasure to be able to work with Buzz Stewart and Krista Bruce and Krista Wilson-Jones, who are co-founders of MedCurio, because they have created what I consider probably the most significant transformational impact that will enable all the AI digital automation solutions being created by your network and beyond, really to work in real time with EHR and other data.
It's fantastic. And you're going to be at the Innovator Summit during New York City Health Innovation Week, the week of May 5th. The summit's going to be Times Square, and talk a little bit about how your platform, really this kind of no-code access real-time EHR platform, Venue is going to actually accelerate this kind of access to healthcare, reduce costs, and improved overall quality through this kind of novel model you guys have built called this trustworthy AI automation scale.
So MedCurio's platform is called Venue, and Venue has the ability to access all data inside of an EHR. And Epic is a series of application layers, and the core EHR is from a company called InterSystems Cache. So we can access all 90,000 data elements through one endpoint in real time. So it's an unbelievable breakthrough, and it is far superior to vendor APIs, FHIR, HL7, which are the current mechanisms of accessing data. Those were never designed to access health data, EHR data in real time. And so the team that I work with, Buzz, Krista, and Kristen, they spent 16 years at Sutter and Geisinger trying to automate healthcare with digital and AI and different approaches. But they were unable to, so they left and they formed MedCurio, medcurio.com. They formed MedCurio, and then through their own money and then partnering with the AMA, American Medical Association's Health 2047 Venture Studio, which also has silent funding from United Health Group and the founders' money, they created MedCurio and Venue, which accesses all data, which is not possible. So what took them 6 months to do can be done in days and weeks using the Venue platform.
It's incredible as patients begin to see, when they're going into a hospital system, they begin to see just how complex the IT infrastructure, the workflow is within hospitals. It's really extraordinary to see how it's important to have something like Venue there to help change that and improve that workflow. From what you're seeing, from where you're deployed today, and again, just for our audience sake, this is something that's actually working. This is not vapor, and it's going to be at the summit, so you can take a look at it in New York City Times Square, like Richard Hanberry's Sana model and the solid glasses from Neil, and that's curing blindness for some folks. How is Venue changing the conversation for hospital leaders and health system leaders today?
Let me give you one specific use case. So Venue is infrastructure, and we're building solutions to operate across the entire health system process. So one use case, one of our major health systems, Fairview, replaced the vendor APIs for their patient portal, of which they were paying $1 million a year to access their own data, my data as a patient, within their portal. One use case, they saved $1 million. The platform is extremely affordable. It's an annual license fee, and it erases all data access charges. So the value proposition for a $6 billion health system across 10 priority use cases is roughly 200 million in financial impact, increased revenue capture, improved revenue cycle management. And now, more importantly, we are partnered with Salesforce. So Salesforce, and we're adding 10 additional health systems through our relationship with Salesforce. So Salesforce has generally just been used for patient acquisition. What we do is now allow, and it's been difficult to use it for scheduling, care coordination, referral management, care gap closure, because of the difficulty and the time and the cost in accessing data. We erase all that. So with real-time access through a very affordable, cost-effective platform, now Salesforce can work its true customer relationship management to support patient support across the continuum, along with overall population health. So that $200 million impact with all the health systems looking to save costs is really important, because we cut costs, but we don't cut clinical costs. We allow care teams to operate at the top of their licenses.
Yeah, I think what's nice is that we got about a minute left. What's really nice for our audience to understand is that, you know, a lot of the apps and a lot of the wearables that you see when it comes to digital healthcare, remember, digital is all about the data from the human being and around the human being. It's not just apps and devices. It's anything from electronic health records to infrastructure to biomedical informatics, you know, metabolomics, exosomics, et cetera. When you look at Venue and what they're doing, and this is to the audience, it's about the ability to accelerate data exchange from 1 to 2 weeks via Epic to 1 to 2 hours, 1 to 2 days via Venue. And that's a massive change for improving quality for patients, improving access for patients, and reducing costs and increasing revenue for health systems. So now I need to know, just for the audience sake, Doug, you guys are on the App Exchange, which for people that don't know Salesforce, that's like having an app on the App Store versus not. And so now any hospital system, which is most in the US, can just use the App Exchange and dial into Venue very quickly. But while you're doing this, what are you seeing? Is it improving outcomes? Is it improving revenues? Is it reducing costs? Is it reducing the overall cycle time? Where's the biggest value proposition in your platform?
It's across all of them. This is infrastructure. We're not a point solution. We are a comprehensive infrastructure, and we're creating the solutions that will make it even faster. So it's like downloading, we operate inside the health system. It's like downloading Microsoft Office, and you create the documents and the whatever you want. But we're going to create a set of solutions that can also decrease the time to market. So we save money, we increase revenue capture, we improve quality, we improve patient care, we decrease clinician burnout, because we're truly a mechanism to automate and access all data inside the EHR in real time without toll charges. I mean, the entire industry spent billions of dollars, but they agreed to pay toll charges or data access fees to access patient data. It doesn't make any sense. So we're going to break down the walled garden, and this will be the new standard of patient data access with my futurist hat on in 3 to 5 years.
Doug, thank you for joining us today, and looking forward to seeing you in 2 weeks at the summit.
Great, thank you.
Please do connect with them. We've got folks from all over the world joined us today. We're really excited to see everybody, folks from the investor community, the hospital community, the FDA, NIH communities, and certainly HHS, all the sub-communities around the US healthcare system, a lot of life science folks, a lot of startup folks. So, and if you want to connect with me at all, please do check out my LinkedIn. It's on the chat as well, and happy to talk to you if you have any ideas for topics or speakers or technologies that we should be featuring. Please let me know. I'm very happy to work with you and your team or whoever you're working with, and certainly work with our team from Ansley to Jerry to the whole team at the lab to make sure that we're covering the most important topics and the most relevant topics for you all to be successful in your innovation efforts. And we're on to our next hour. So this is hour number 2 for the April Symposium, and we're going to kick it off with a homegrown innovation in New York City who's reinventing how labs are able to manage all of the data and all of the stuff that they're doing. You know, particularly when you start considering that most labs are being run by postdoc, PhD candidates, and a lot of undergraduates. If you're an investigator and you're developing a new molecule or a new device or a new anything, and you're running a lab, you want to make sure you've got systems around that process that those folks are checking into, so you can manage it by dashboard, not by a million meetings a day. And that's what Unica and her team are putting together with the Proficient Lab. Hi, Unica, how are you?
Hi, Stan. I'm doing good. Thank you so much for having me today.
Now, just 1 minute thumbnail on yourself and your company, just for the audience that doesn't know you yet. That'd be great.
Yeah, absolutely. So I'm the co-founder and CEO at the Proficient Lab, and what we do is AI-driven electronic quality management, and our system really allows multiple organizations to function as one, as well as provide AI tools to make things more efficient and just simplify the process compared to more older, archaic solutions.
That's great. And you're also going to be at the summit coming up in 2 weeks, New York City Health Innovation Week as well. And if you could talk a little bit about how your implementation of AI in method validation is going to help folks in their clinical trials and real world health applications.
Yeah, absolutely. So method validation is something that a lot of times we don't think about. So with clinical trials, whether we're talking about clinical trials or we're talking about just regular diagnosis and testing of our general population, part of what needs to happen to get to an endpoint is testing. So testing is a crucial part of going through a clinical trial, understanding different biomarkers, understanding different analytes. But before we get to that testing standpoint, all of these tests need to be validated. And this validation means that we need to understand the statistical claims behind these tests. Can they be reproduced? Are they sensitive enough? Can they actually be repeated across multiple places? Can we compare them to other types of equivalent tests? So this is a process that historically takes quite a while. We're talking about weeks to months in terms of completing this. And what we're doing is implementing AI to assist with getting the subject matter experts who need to get these tests validated to move clinical trials along. We're using AI to speed up that process. So taking method validation from a month-long process down to a week or two using AI.
Amazing. And that, I think that's what we're talking about when we're talking about breaking barriers. Just to bring it back to the overall theme of what today's meeting is about, I mean, for the audience, we're trying to help startups, whether it's a molecule or device or digital or biotech, like cell and gene therapy. We're trying to help them find digital ways to make these things work more efficiently so we can get to approved interventions faster. And the digital infrastructure is a big part of that. And obviously, Unica AI is a big part of that as well. And at the summit, we're going to be talking about AI every day, almost all day. AI is just completely transforming not only general workflow, but also how work is being done in healthcare, patient delivery, and life sciences. What are some of the most important challenges that you're anticipating when it comes to using AI to validate tests, and how can that overall trust that people, or distrust really, people have in AI be built around this kind of method validation?
That's a really good question. So in terms of challenges, I believe that, there is this notion that AI is the end all be all, and it could replace what a human being could do. And for the most part, it speeds up processes, but we still need those checks. So in terms of what we currently have with our regulatory bodies coming in and doing those checks, we're still going to need that even if we use an AI system. So being able to meet those requirements from a regulatory standpoint with AI, at the end of the day, is going to start building trust, because the regulatory agencies are going to be looking at this through the same lens as, if a human being were to take this from end to end. So this is as we go through and as we start using these AI tools to be able to submit our data for trials quicker, being able to get a lot of these through our regulatory bodies is going to eventually start building trust that AI can be used for these types of methods. And I will say that if you're using any company that is, dedicated to AI and pushing the industry forward with AI, you need to ensure that that company itself has things in place to validate what they're doing from an AI standpoint, and that they are on top of it, and they're constantly iterating and pushing forward with newer and the most current technologies in terms of AI.
All right, so that's I think when we start putting the pieces of the puzzle together to see how this kind of infrastructure that you're building for lab management, it does make sense when you start talking about how AI is going to just reinvent how inventors, entrepreneurs, scientists are going to be able to use AI in this part of their work with lab management. And we've got about a minute left, and would like to know a little bit more about how you're seeing health systems and innovators balance the urgency for AI-driven solutions and reliable data so that they can meet industry standards, for instance, like in what labs are building for patients in the future.
Yeah, so I think it's a matter of finding the AI that could fit into that doesn't take your team too far away from their workflow. So it is a balance. It's a balance between introducing something new that could be more that provides more efficiency, but ensuring that new piece of tool, that new tool that's being marketed as an efficient tool, isn't taking your team away from their current workflow. So I think that is a balance that, regardless of what type of AI technology or technology period that you implement, you do have to really understand what the workflow is and not put a point solution into your system that's going to be more of a distraction. So I think that's where we have to kind of think in terms of balancing this new technology and how it fits in with the current workflows.
Brilliant. Well, again, Unica, thank you so much for building this kind of a platform. As a patient, obviously, I'm really looking forward to seeing it diffuse rapidly across the system and be seeing adopted a lot more, and also looking forward to seeing you at the summit in 2 weeks.
Wonderful. Okay, bye. Thank you for having me.
All right, so we are moving through the second hour, and if you want to meet Unica and what she's doing with Proficient Labs, again, don't forget to sign up for the summit, and we'll see you there. In the meantime, we've got our own Breakthrough Alliance board chair, Bill Toronto, the head of the Merck Global Health Innovation Fund, interviewing Neil Weinstock, again, another New York City entrepreneur developing a revolutionary platform for people with different forms of blindness. Bill, good to see you online, and handing it over to you.
Thank you, Stan. Appreciate it very much. And Neil, great to see you again. We'll always look forward to these interviews. The first question I always like to start with, Neil, as you know, so the audience may not know who you are. And I like to ask you if you can tell the audience about your career journey to becoming the CEO of Solid Corp.
I wish I knew who I was. I've been involved in for so long in innovative product development, starting up companies in networking and audio and video. How I came to the health area really just amazes me. We started out Solid several years ago, a long time ago for a startup, to do something entirely different, because nobody sets out to discover something that's never been thought of before, right? So we were doing a super high quality, large light field display. And when I had a look at the prototype that my co-founders and I had developed, which was great, by the way, it started to impress me that we could accomplish something for near-to-eye systems. And we went on to be able to discover some brain functionality based on making use of our optics that no one had ever thought of, which is that we can create stereopsis, the ability to see stereo, from many, many separate in-focus images projected to different areas of the retina. And we make use of that for a lot of things. The low-hanging fruit is if there's some area of visual field that is occluded because of some health issue. In particular, we tested very rigorously last year for macular degeneration and Stargardt's disease. We can give full field sight with good acuity to those people who suffer from that condition.
Great. Thanks for that. As an introduction, you might want to explain to the audience that Solid actually won the HITLAB Breakthrough Alliance Challenge in 2023 because of your revolutionary way that you give full field sight and good acuity to people with macular degeneration. Can you talk a little about that? What your involvement with HITLAB a little bit and what that meant to you to win that challenge, which was pretty important win, I think.
It was tremendous. You guys were extremely helpful, and my thanks continue to go out with you. It helped to put us on the board, helped us get into 2 other accelerators that we came into after we won that award. Mass Challenge, which gave us a very nice grant, and the HTech Collaborative of the AARP, and the AARP wound up investing in us, gave us credibility with a lot of other investors and with the community, and it was just wonderful to get that award. So thank you again.
Fantastic. Let's talk a little about your product. Can you talk a little about the form factor and when we'll have the product available in the market?
Yeah, so we are heavily into production activities now. We don't have the product out to market yet. We actually introduced ourselves to the world at the Consumer Electronics Show in January of this year. We got tremendous press coverage, I'm told, by our wonderful PR guy, Henry Feintuck, who was here in New York too, and I highly recommend him to MedTech people. We got well over 1 billion, I think 1.5 billion impressions. And that just helped get word out and fill our pipeline with thousands of people who signed up to get the product as soon as they can get it. And so got us on the track. We think we're going to introduce the product to the world, the actual production versions, at CES next time, this coming January. We'll probably have some product available earlier than that. You never know exactly because we're manufacturing, and manufacturing, unexpected things can come up. We have contractors and contractors passing through a supply chain to other contractors. But in the meantime, and here's a little bit of news that we haven't talked about, probably in June, certainly this summer, we will have a few test devices tethered to desktop PCs, which will be placed in major ophthalmic research and university locations that seem to be very eager to work with us. We will have 5 of these devices in a few places in the United States and in Europe, and we will be testing. We'll be testing in much more detailed ways than we could last year for macular degeneration, and also testing a number of other health issues. We're pretty sure that we can deal with anything that occludes some portion of the visual field and help people have a much larger visual field with better acuity. For we've tested 1 or 2 people each with issues such as optic neuritis, cone rod dystrophy. We've helped people with focal problems and amblyopia caused by MS. We've had many suggestions from neuroscientists and physicians. Can you try this for Parkinson's? Can you try this for people with autism, etc.? So we want to test a lot of things, and that's likely to be a large ongoing program for us because, I'm an engineer, I'm not a scientist. We need the help from all the scientists and physicians who we can kind of get on our team and be a platform for them and the research that they do.
Yeah, I'd like to ask a question a little more detailed about your answer that you just gave about other areas. On your website, you've shown great results from your earlier trials for correcting vision loss for macular degeneration and Stargardt disease. And on your website, you have mentioned what you just mentioned now, testimonials from people with other types of conditions. Is there any specific condition that you think beyond, the macular degeneration is probably your next closest one that you might focus on? Because you mentioned, 3 or 4 other types of eye issues, but is there one that is, probably closer to what you're already working on that might make sense from a clinical trial perspective or just a next step perspective?
I think that we can almost guarantee at this stage that anything that's blocking the central region of people's vision looks like it's a slam dunk. The central region is what we could really focus on in our tests last year. We weren't able to have what we're building into the product is the ability to map very accurately just really everything that's going on in the eye. with AI understanding of the visual information that we are taking in so that we cut out static in the visual understanding of what we see. So when I talk about optic neuritis, there's a woman who testifies on our website about her central cone rod dystrophy. Central area vision loss, I think we feel pretty secure about. Also, I think right from the get-go, people with amblyopia and focal problems, which combine with multiple sclerosis, which I have a lot of experience with living with someone who suffers from that. I think that we're going to be able to do tremendous help, right from the get-go without having any particular software adjustment for the product. I think we'll see some surprises too in some pretty easy software tweaks that we can do to help some other issues that I don't want to forecast exactly yet. I don't want to promise too much, but from what we've seen so far, that seems pretty apparent that we can help with.
Yeah, your technology is unbelievable, and this is such an important area. Where are you going to be conducting these tests as you move forward?
Well, for sure, here in New York, we've had a wonderful relationship so far with the people at Lighthouse Guild, and I think we have a wonderful budding relationship with the ophthalmology people at New York Eye and Ear. Just tremendous help we've already been given by a number of great physicians. Dr. Richard Rosen at New York Eye and Ear, Dr. William Seipel at Lighthouse Guild, also Dr. Brian Walensky there. And I think that we'll have test locations in California, probably Florida, probably one floating around. And we have a tremendous relationship developing with a group called Street Lab in Paris. And I think that'll be our one outside of the United States location.
And final question, how do people sign up if they feel that they could be a good candidate or a potential candidate for one of your trials? How do they actually sign up for it?
Well, we will have, here's another little sneak peek disclosure. We're building out a area of our website where we'll pre-qualify people and get people in line to go into the testing. And of course, the people who will be in line for that are those who've written into us to get our newsletter, right into info@solid.com. And it's been tremendous, the response that we've gotten. So we hope that many of those people will show up for testing.
Fantastic. And Neil, congratulations on all the progress you made. I was a judge at that 2023 Breakthrough Alliance, and I'm just amazed at what you've accomplished so far. And thank you for your time today. I appreciate it very much. Stan, turn it back over to you before you turn it back to me again.
No, I think Bill, and again, Neil, thank you both for jumping in. And Neil, again, looking forward to seeing you at the summit in a couple of weeks at Times Square. As you can see, we're about halfway through the April Symposium, and Bill is going to be interviewing another winner of HITLAB Challenge and Adi Diner. And so looking forward to hearing about this, another breakthrough technology that we're extraordinarily lucky to have and honored to be working with. And Adi, are you online? There you are. All right, outstanding. All right, so we'll hand it back over to Bill.
Thank you very much again, Stan. I appreciate it. A wonderful pleasure to meet with you. And like I was saying before, as I always like to start with the same question, the audience may not know who you are, and we'd love to hear about your career journey to being the co-founder and CEO of iFocus Health.
Thank you very much, Bill, and thank you and the HITLAB team for having me here. It's always an honor. So before being a CEO of iFocus, I have a PhD in physics. I developed hardware products from biotech, lasers, defense, and medical devices all across the board. I always like big challenges. And I started tackling this one because of my personal experience. I was diagnosed with ADHD back in grad school. And then a few years ago, my kid was also diagnosed. And I thought that it can't be that we are relying on the opinions of a teenager to know if the medication is working. So that was the trigger to try finding objective measures in this space.
Okay. Well, let's start with the core of what makes iFocus Health so unique. Talk just a little bit now, you touched on it, but how did the idea come about, and what was the moment you realized that eye tracking and AI could change the game in ADHD care?
So as I mentioned, we were looking for a measure that would be objective. Coming from hardware and physics, I knew it has to be very simple and very scalable. So has to be something people can do from their own computer. And that's what drove us to look at eye tracking from the webcam, the same one we are using in many Zoom meetings, including this one. Then what's unique about the approach we took is we're not using eye tracking is a tool, but what we're doing is we're looking at reading processes and changes in reading process. So we're looking at a measure of a process or something everyday challenge we all tackle. And we started looking at reading because that's a struggle for many people with ADHD, even those that read well, when the content is less interesting, if it's more work related, it becomes much harder. The AI comes in here, AI is a buzzword for everyone today, but inherently what it means for our product is we're not rule-based, meaning we're not looking at if A, then B. And I think that's a good way to describe ADHD in general. If you look too close, it will go away. If you look at someone with ADHD for 2 minutes, you can't diagnose them. It has to be a bigger picture thing. It's more than one measure, feature. And that's why we're using AI to get this complexity into our product.
So let's talk about the objective you were mentioning earlier, bringing that to the ADHD treatment in a space that's often trial and error. How
Yes.
are clinicians responding to the platform, and what kind of shifts are you seeing in patient outcomes?
So clinicians are really excited, and I have to say that was a positive response. We are 3 founders with a technical and business backgrounds, but we're not clinicians. We're working with leading clinicians and part of our board, but across the board, clinicians, even the best ones, know they're not mind readers. And especially they can't know what's happening at the patient's home or school. And they want these measures, especially when you talk to pediatricians and PCPs. They're really frustrated with caring for ADHD because they don't have the time or the training to really do a good job with these interviews and assessing subjective feedback. And when they have our tool, it's like working with lab work, if you want. Sending someone to get the lab work or to measure blood pressure. It's a measure. They can document it easily, takes less time, and they can do a better job. And that's where we're getting a lot of excitement from clinicians. And we have amazing feedback from patients as well. We have over 700 users today, and they finally feel they have something to look at that feels, one parent told me, I'm afraid for medication because my kid is not a guinea pig, right? I don't want my kid to be guinea pig. When you have these objective measures, it feels more real. It feels like you know what you're doing, which is so important.
Great. So I know there's been a lot of momentum lately. What's new at iFocus? Do you have any updates, partnerships, any upcoming launches you're excited to share about?
So we have many things in the pipeline. I can't share all of them. I can tell you that we do have interest from pharma companies. The innovation in pharma in this space is mostly about the delivery. So finding medication that works better throughout the day. And today there's no good measures for that. And using iFocus, it's very easy to actually make a measurement. And we actually published a case study when we measured how medication affects me personally throughout the day. We're very careful with patients' data. That's why and it got a lot of interest because that helps them actually show where the innovation comes place in their differentiation, which is really important in the market. We also are discussing a pilot. Actually, there's one we can share. We have a pilot in progress with a clinic in the UK for our next product, which is a screening tool. We've shown in POC that we can actually measure the difference as screening to help clinicians to know if they should refer patients for a further assessment. And we're working with this clinic to actually validate that and get more data.
Good. So I want to talk about a little about the future as our last question. ADHD is the beginning. And when you look ahead, where do you see this technology having a major impact broadly in brain?
So if you think about the crisis everyone talks about in mental health and behavioral health, of not having enough clinicians, think for a second, why is this happening, right? There is more awareness and all that, and that's very important. But also, if you compare it to physical health, most of our care happens by the PCPs. In mental health, they're not able to do that because they don't have the training or the time. It's all subjective. If we can get more objective measures across the board for behavior and mental health, then you can get more people be treated well by PCPs and also identify the ones that need specialists better because you can actually see the differences. So that's the vision. And because iFocus is essentially a measure for cognition, it can go in so many directions beyond ADHD. Depression affects your cognition. Of course, neurodegenerative affects your cognition. Anywhere when you want to actually measure changes, which is so important because in the end, we want to improve our life, not some theoretical life compared to some theoretical definition. That's important for diagnosing, but if you want to measure improvement or deterioration, you want to actually see it in real life.
Well, wonderful. Well, Adi, it was just a pleasure talking with you. Congratulations on all your success and best of luck as you continue to develop iFocus going forward. Thank you very much for your time today.
Interview, Bill, and thank you, Adi, for joining. And these are the sorts of technologies that we are very excited to work with every day at the lab, and we're seeing the adoption of these technologies happen in not only segmented parts of our community and patient populations in the US, but also other parts around the world. And one of the companies that we're excited to be working with today is the one that's coming up next, which is My Physician Plan. And this is an organization that is giving access and providing access to people who are in the United States. Maybe they have a medical issue, maybe they have a chronic issue, maybe they just want some access just in case they're coming through. But I'm going to be talking to the co-founder and CTO, COO Gaurav Gupta now a little bit about My Physician Plan. And hopefully you'll see again how this is another company that's breaking barriers in healthcare in the United States and providing more access, giving different ways for patients to get access, and reducing the cost and the overall blockages to healthcare. Gaurav, good to see you. Welcome to the program today.
Thanks for having me.
It's great to see you. And if you could just start off with a little bit about your background and what you're doing with My Physician Plan.
I mean, my background, I'm a computer science engineer by background, and I was actually on Wall Street for a good 10 years before pivoting to healthcare about 10 years ago, or more than 10 years now, almost. But when I'm pivoted to healthcare, and in Wall Street, we used to constantly say that healthcare is probably the only industry which is more regulated than Wall Street is. And that is probably true. But once I pivoted over, I also realized that we do have a lot of red tape. And unfortunately, that is what is preventing access in a lot of cases. And it seems to affect most the uninsured people because you end up being treated like this pariah, which doesn't have care. And no matter which doctor you go to, you don't get good access. You get charged a humongous amount, which is nowhere near what reality is. The same thing happens with prescriptions, and the same thing happens with lab tests or anything else that you do, like which you need. And coming from India back, I mean, to me, primary care was like something which is really affordable. And to me, being in America, like finding that there are like 15% people who don't have good access to a doctor. And just because they don't have insurance, it's not just that if they get cancer treatment, it's difficult to get, but like getting their routine chronic care visits can get like a big amount that you can't cover otherwise. So my co-founder, Ramdev, and I, we started looking at this problem, and Ramdev actually told me that if we break that piece apart and look at primary care component only, we can clearly build the infrastructure and the technology to make this happen at a much more affordable price. So his initial numbers were like, we can cut like more than 30-40% of the red tape, which happens at the primary care level. And that brings down the price substantially enough that it makes it very affordable for anyone to get access, as well as make it possible for these people to get taken care of their routine visits, so be it sick visits, chronic care visits, your prescriptions. And when initially my gut feeling was that, no, that would be too complicated to build. But the more I looked into it from a compliance point of view, from a healthcare point of view, it was like, no, it can be done. And at that point, it was more like, why are we not doing it when we can make this thing so much affordable, especially for primary care?
Yeah, and I love this. And we're seeing it so much around the world too. And again, my physician plan, if I remember correctly, it's both available in the US and around the world. So how are you doing? I mean, everyone who's on this program is pretty well familiarized with healthcare systems, health management organizations, both staff and group models, PPOs, EPOs, and just everything that's going on with network solutions and different ways of channeling patients to providers. What are you guys doing to build this global network of physicians to give patients affordable access to these networks?
So our approach has been, I mean, first of all, we're not a global yet. We are only in the United States. But the main approach that we're really doing is especially when you look at the primary care part of it, it is primary care to me, or the way our experience has been, is fairly simple. Yes, they still have to deal with these 120 or maybe 200 plus CPT codes, but at the end of the day, it is coming down to like this interaction between the physician and this thing is coming down to all these 20, 50, 100 codes are coming down to just a simple visit, whether it is an in-person visit, it's a televisit, is it a long visit because it's an annual physical, or it's a first-time visit. So we looked at the whole scheme on how doctors are getting paid, and we simplified it significantly. It has become so simple that in most cases, like not most cases, in all cases, it is even before the doctor has seen the patient, based on just the basic information that the doctor asks for you when you're trying to get an appointment. Just based on that information, it is clear exactly what kind of visit to expect and what is a reasonable payout for the doctor for that visit, for example. So we take that into our consideration, and we from our point of view, we even before the moment the patient checks in with the doctor can get paid, typically gets paid within the same day. In fact, within hours, the doctor has the payment done. So the doctor is secure in terms of what they're being paid. There's no red tape to worry about, no haggling afterwards with the insurance company or anyone else on what your CPT code was. Was it the right CPT code for this visit or not? Was it you just need to have a different CPT code and you'll still get paid the same amount. There's no haggling, and you're guaranteed this upfront payment, right? So and by doing this, we also get out of the way of what the doctor and the patient want to do, right? So we are saying that if the patient needs to go to the doctor and the doctor is happy to take that visit, then we'll make sure that payment happens, and it's as simple as that. So that has significantly cut out red tape tremendously, which is helping us bring a lot of savings to the system, which potentially we can now share with the doctors, right? So we are paying doctors a fair amount. It may not be as high as what some of the other insurance companies are paying, but it is reasonable for the service that they're giving, and they're happy to do that.
Yeah, especially with these kinds of remote platforms. Talk a little bit about that. I mean, again, you guys are enabling this age of digital care to bring healthcare services and healthcare expertise to patients that would otherwise not understand it, not be able to access it, whether they're visitors coming in from another country, or they're students in between jobs, or they're people in between jobs, or whatever it might be. So how is digital helping you build your platform?
So from our point of view, from a digital health point of view, we have simplified the entire process end to end, right? So the patients are able to get to, or members are able to get to the website any point in time, sign up at any point in time, and technically, like, because of that process that we have streamlined so much, even on the onboarding side, the card and the member immediately gets a digital card, which is active the same day, and he can use to visit the doctor the same day. So that process is extremely streamlined and straightforward right now, especially at our primary care net doctors, which are part of our network. They can visit the doctor. Doctor can also go online and verify the same minute that the patient is actually, yes, he has a card and this is a valid, and they can, while they're checking in the patient at the front desk, they can check into the platform as well, which is what most of the doctors do, and they get paid within minutes of making that happen. So this entire process has been streamlined. The patient is signing up, so we have multiple plans. So the basic plan that we have is the primary care plan. which is $75 a month, but it is discounted if you're buying for the full year upfront or things like that. But then we also layer on top of it. We noticed a lot of people signing up with us were visitors coming internationally, because these travel insurances from most countries, when you buy them for the US, they will cover catastrophic needs, but they don't cover chronic needs. So if you are here for multiple months, 3-4 months, even longer sometimes, there's no way for you to go visit a doctor for chronic visits and get your updated medications. So we're noticing a lot of those people were signing up with our plans. So we actually partnered with Crum & Forster, and then launched a US-based travel insurance plan. And in that, actually, we also use United Healthcare as a backup network for specialists and emergency rooms. But the routine care visits get taken care of. And the same way, we layered it with a health share network called for offering people for those unexpected and large medical needs. And later this year, we will be also launching. We're noticing a lot of people signing up are also actually students, because they are very price sensitive and they end up with these high deductible plans, which are really great for catastrophic needs, but then they don't, unfortunately, most of them also don't cover primary care. So if you are a student with chronic conditions, or even your simple annual physical can easily be a couple of thousands of dollars. So we are noticing a gap there, and we'll be launching our student plans probably in the next 2 months to be ready for the next calendar year for the school. And we're also working with the TPA to launch self-funded employer plans, where we can potentially have a custom ACA compliant plan for small businesses that they can offer it to their employees at a substantially, be able to choose the benefits you want and layer it essentially with our primary care offering, that you have something for catastrophic needs, but your primary care is not left on the wayside.
I love this. I love this. What are you doing with AI? How is AI playing a role into this? And again, for the audience from around the world who has questions around this, it sounds like this might be an opportunity for partnership as well for a global implementation, or even a US distribution channel. Just ask questions away in the chat room. But talk about AI, Gaurav, because obviously that's all we're going to be talking about at the summit coming up, whether it's in women's health or whether it's in remote health or whether it's with devices, et cetera. How are you going to be using AI to bring this to more patients and being able to do it more affordably?
So what we are working with AI specifically is we are basically taking a standard model of AI and making a custom version which is specialized to our needs, right? So we are doing things slightly differently. Yes, we rely still on a lot of the infrastructure which the existing healthcare network has. So we do want to rely on that knowledge base. But then we are able to layer on top of it our knowledge base, which is what we have. And essentially we're working on this chatbot, or you don't call it a chatbot, but basically kind of a help assist, which will help people navigate their care, right? So it's not just that they need to answer a generic question, but they need to be able to answer specialized questions the way we look at it, right? Like the way we onboard patients is simple. And frankly, like when I first tried to put my knowledge base into the AI tool and tell it, how do I sign up for my physician plan? It gave me like 10 questions that you need to ask this person just before they're on board. But we don't use any of that. So I need to train AI to make sure that it only says that, oh, we only need your name and date of birth and an email address to contact you. That's about it. So all those customizations, we're making our knowledge base on top of AI so that it boosts it with the existing programs, existing knowledge base of healthcare, but be able to be a complete assist so that the patient can come to one spot and get all the answers, all the questions answered.
That's amazing. And there's obviously a lot of opportunities too, just in other models. Like, for instance, Amy's going to be talking to one of our companies and that we've been testing, Recovery Plus. They're phenomenal. They're getting nothing but A+ on our scores for not only experiential, but clinical, as well as integrational. They're easy to install and get up and running. How could someone like what you're doing with My Physician Plan work with a home-based recovery platform? I mean, there just seems to be opportunities for you guys to bring in so many different tools from AI to back-end infrastructure, even working with groups like Medcuria that we just talked to link in with hospitals' back-end infrastructure as their front-end distribution or front-end provider, like a massive network funnel, from a PPO standpoint. But what kind of distribution channels or what kind of partnerships do you really want to focus on over your next year of growth?
So for the next year, we are focused quite a bit. So I think on the technology side, we have a good sense of where we are. We are focusing heavily on distribution channels. So brokers, agents, payroll companies, universities for student plans. So one is the distribution channel because we want to partner with them and educate them with the offering that we have, because this would help a lot. But while we're doing that, we're also exploring other innovative ideas in digital health that we can potentially incorporate with our platform. So there are a few conversations we are having with, and potentially we'll explore them later this year. And as our user base is also expanding at a good pace, we are at that scale that potentially we can bring some significant benefits if we start using these things.
That's great. And of course, we have an extremely active audience, as you know, right? And they're all doing a lot of interesting things in healthcare. Everyone from, again, like I mentioned earlier, from startups to healthcare executive across payer, provider, employer, pharma. Folks from the NIH, FDA, HHS, CMS are on the show right now. And so one of the questions coming in is just a quick quick answer on this one. How many current patients or lives or whatever you measure your customers, how many folks are using the platform today?
So we're still a startup, right? So it's not a big number, and I would say it's in the hundreds, not the thousands yet. But we are at that cusp that I think will very soon be in the thousands by the end of this year.
And does a patient pay on a fee for service, or is it basically all you can eat? Once you pay your monthly membership fee, you can talk to as many folks as you want, or how has that worked?
So once a member signs up, we let them have as many visits as they want with the doctor, especially the primary care, and we like to have a preferred like home doctor, as you want to call it, because that is where your medical records get maintained. And if you're going for emergency visits or something else, they act as consolidating all that information, and that is one more benefit that we bring in. We kind of actually push our patients a lot that you do need to have that primary care visit and have that relationship with the doctor so that your medical records get maintained. So while we don't act as a repository of maintaining EHR, but we insist that all our patients end up with their medical records being maintained at some place, so that if they have any emergencies, they get covered there. But basically, once you have the monthly fee or one of the plans that you have with us, you have this premium primary care, where you essentially are assigned a dedicated doctor who is your caretaker in a sense to help you in all your health needs.
Okay, that's great. And then last quick question, and then we'll jump. But the patient clinical history, that's always important, right? Is that available to the clinician at the point of care, or is that something that the physician is getting when they're talking to the patient in real time?
So right now, it is available to the physician when they talk with the patient directly. But that is also something which we are exploring, that in a lot of these new patients who are just getting onto the system, one of the issues that we do have is that because nothing is maintained in the past, it takes much longer than typical patients to onboard them. So we are exploring some actually AI tools to kind of make that more precise and potentially offer them to the physicians in advance so that they know what to expect from the patient coming in.
That's fantastic. Yeah, I really, really appreciate that. And again, wishing you all the luck in your overall journey, really, of adoption and diffusion in the healthcare system. And for the audience listening, don't worry, you'll get updates. We always like to bring folks like Gaurav back so they can provide more details on their never-ending journey and insights on what startups should be doing, whether it's getting the next round of funding, or whether it's how to actually get into the provider market, the payer market, the pharma market, the employer market, whatever it might be. And so again, really looking forward to hearing from you. Looking forward to seeing you in 2 weeks at the summit. And for those in the audience, don't forget to sign up for the summit in 2 weeks. All right, thank you, Gaurav.
Thank you.
So we are doing really well. Another amazing journey and story about how digital health is helping break the barriers in the US healthcare system. And as we all know, when it comes to free market healthcare, we can't have enough innovations when it comes to things like My Physician Plan, certainly Solid, and with Proficient Labs, Medcurio. These are the sorts of startups that will have an opportunity to change lives for millions, tens of millions, or hundreds of millions of people around the country. And right now, you can see we have a poll that we're looking to not only have you answer, but also publish about at hitlab.org. Later on this month, but we would love to get your input on it first as one of the many healthcare experts in the HITLab's 450,000 member community around the world. So if you don't mind, answering this one question. It should take you nothing but 5 to 10 seconds, I hope. How should startups prioritize innovation during early stage growth? A, innovate at all costs. It's your only advantage. B, balance innovation with business fundamentals. C, prioritize market fit first, innovate later. Or D, follow the customer, not the idea. D is more about just optimize the revenue and be opportunistic about the customers. All right, so the poll is open for about another minute or so, and we're getting great participation. So thank you all for answering. And I'm sure at some point in the future, Zoom will launch an AI bot so that you won't have to answer it. It'll just scan your last 10,000 emails and figure out your point of view, and you won't have to answer polls. You'll just have an immediate AI bot on Zoom answering your polls for you based upon your preferences and your overall take on life. And so this will be published out. We'll let you know what the results are like, and we'll be actually talking about it. So if any of you are actually interested in co-publishing something, just again, drop me a LinkedIn note and would love to co-author with you. We love to publish at HITLAB. If you're not already subscribed to our newsletter, please do subscribe. We're always looking for new author collaborations and new topics. There's no shortage of topics to talk about these days, that is for sure. And next up, we're excited to bring on a whole host of folks that are going to be impactful players in what we're doing. But first up is going to be Brian Powell. And Brian is an Associate Director of Social Media at Bristol Myers Squibb, and is doing a lot with Bristol Myers virtual assistants and conversational AI technologies. And he's going to be interviewing someone, a company, and an executive from a company that HITLAB tested early on and then went through the Mayo Clinic Accelerator after HITLAB's verification test. And he's actually the co-founder and COO of AcuCardia, Sadek Ali. And so with that, I will hand it over to Brian. Brian, you officially have the floor.
Oh, thanks. Appreciate it. Hope everyone's having a wonderful day. Stan said hello. My name is Brian Powell, Associate Director of Social Media, Podcasting, and Virtual Assistant Capabilities at Bristol Myers Squibb. Today I have the pleasure of speaking with Sadiq, and again, the co-founder, COO of Corkita. Today we'll be chatting about ECG as a broad digital biomarker and its potential to transform healthcare. Hey, Sadiq, how's the day going for you so far?
Pretty good, pretty good. We'll get into that, I'm sure.
Well, yeah, glad you're having a good day. We're going to have a good conversation either this afternoon, this evening for people across the pond. But just diving deep into it, Sadiq, what does it mean, ECG as a broad digital biomarker? And secondarily, how does that define or redefine its role in the modern healthcare?
Yeah, so when you think of broad biomarkers, let's leave the word digital aside for a second, really do come to mind from the point of view of really physiological biomarkers. The first is blood, and the other is DNA. Both give you a lot of information around someone's physiology, how they may be doing, how they may do in the future, etc. You don't think of ECG as a very broad biomarker. You think of it in the context of certain conditions, certain arrhythmias, certain types of heart attacks. You don't necessarily think of it as really even covering all of cardiology, leave alone going beyond cardiology. And we as a company are amongst a few other companies making the claim that ECGs are a much broader biomarker than previously imagined, both within the context of cardiology, but really well outside cardiology as well. In that context, we have some, our core FDA cleared algorithms primarily focus on a lot of the established use cases such as arrhythmias, but we now have breakthroughs for things like aortic stenosis detection, which traditionally required a echocardiogram, still requires an echocardiogram for final diagnosis. We have another breakthrough for the detection of something called hypokalemia, which is basically high potassium levels in the blood that requires a blood test today. Again, we're able to find indications of that using an ECG as well. And we're not the only company or set of researchers making this claim. A few months ago, there was a study put out in Nature by folks from Mass General at Harvard that basically identified about 600 plus diseases that could be profiled using ECGs. So essentially, we're at a point where we basically believe that there's a lot more information in ECGs than really previously imagined. And that's not that surprising if you think about it, right? So if you think of like a single 250 hertz ECG signal, what that implies is that there are about 250 data points in that 1 second worth of ECG data. A typical ECG is about a 10-second recording. So in about 10 seconds, you have about 2,500 data points on a single lead. Now, if you multiply that out by 12 leads, you have close to 30,000. The number of data points just starts to increase exponentially. So if you start thinking about ECGs over a much longer period, imagine even a single lead ECG recorded at 250 hertz over a 30-day period, you're talking really like more than half a billion data points. There's absolutely no way that even the best, most trained expert, cardiologist, electrophysiologist in the world is going to be able to look at that and draw correlations across all of it and come up with a diagnosis, right? But as a result of AI, we're able to really look at a lot of the hidden data within the ECG data and are able to derive meaning from it, which is why we believe it really has the potential of being a true broad biomarker. Essentially, from our perspective, the third major foundational biomarker right behind blood and DNA, but and in some ways complementary to it, but in some ways useful in ways that neither blood or DNA can be useful, particularly when it comes to things like remote patient monitoring, when it comes to things like continuous monitoring, or ease of use, or cost effectiveness. In all of those contexts, ECGs just work a lot better. I mean, it's nothing more than really the electrical signal of your heart. And by definition, that's easily digitizable. And the minute it's digitizable, it can be analyzed.
That's great. I know you mentioned blood and DNA as other biomarkers to track, but why do you believe ECG deserves to stand alongside blood and DNA as a foundational biomarker for health?
Right. So if you let's take the example of hypokalemia, right? A place it's a significant condition that it impacts people that are on dialysis. People have to constantly watch the potassium level in the blood. 40% of patients, or actually about 30% of patients that are on dialysis actually end up dying, not because they cannot find a kidney. They end up dying because they get into a state that in sort of a hypokalemic state, which induces a cardiac arrest, and essentially that ends up being the cause of death. The way you diagnose that right now or a definitive diagnosis is a blood test. But frankly speaking, a lot of times by the time the blood test is done, the results are obtained, all of that, it takes some time, and it's also pretty expensive relative to an ECG. On the other hand, if you can be if you can be monitored even on a passive basis while you're going about your daily routine through an ECG device, ideally a consumer device that you may have at home, that changes the way in which you can start to both manage these type of diseases as well as potentially predict the onset of these diseases.
Well, that makes a lot of sense. And looking through the news today with your organization, I recently saw that you and Heartbeam announced a strategic collaboration to advance cardiac monitoring innovation. Now, with that focus, and again, congratulations on that partnership again, wonderful job. But with that focus, what does a role of continuous ambient or wearable ECG monitoring play in shifting from a reactive to a preventative healthcare way of looking at things?
Yeah, so I think effectively, the other reason we are very bullish on the ECG signal is effectively AI is one aspect of it, right? AI enables you to see information and get insight from information that you otherwise couldn't. So that's one aspect of it. But there are sort of two other mega trends at play here that make this a very interesting opportunity. The second is that the ECG hardware is becoming quite ubiquitous. In the context of Heartbeam, they have like a credit card type reader where you can literally put your fingers and get an ECG recording. And that's obviously a very, very important step for us, because the easier it is to record an ECG, the more information, the use of it starts to increase. But that's just one example of really ECG hardware being used in a very ubiquitous way. We're seeing ECGs being embedded into everything from not just your smartwatches, but even biofabrics. I think a couple of years ago, the FDA cleared an ECG embedded toilet seat. There are ECGs being embedded into steering wheels of cars. I mean, ECG hardware basically is getting to a point where it's everywhere. And as that data starts to flood the system, you really need to have an AI layer that's able to in some sense, filter the signal from the noise. From my perspective, having a lot of data is arguably worse than having no data, particularly if that data starts to overwhelm your systems, right? So from that point of view, I think having ubiquity in ECG hardware is great, but then you have to have the software that can filter the signal from the noise and make that data actionable. And then the third piece of it, which frankly speaking, has taken off in a big way post-COVID, is telehealth and remote patient monitoring. Because a lot of times particularly for critical conditions, you need to have that last mile capability where if, for example, I'm just throwing out an example of that, right? Like say a ventricular arrhythmia pops up when you're monitoring someone, you don't have much time to react, right? You really need to, at that point, be able to intervene. In that situation, you need to have those last mile capabilities. So really, it's the combination of artificial intelligence alongside the ubiquity of ECG hardware, alongside that last mile remote patient telehealth capability that's come together, that's making this worldview possible. If any one of those elements were missing, it would either not be possible or not be as useful.
I see the evolution of those type of wearables and technology has seen it kind of reach out to places that haven't been able to reach before that last mile. So in your thought process, how do you see the next 5 to 10 years unfolding for ECG-based diagnostics and its role in shaping our global healthcare? I know you mentioned some of them, but what do you say 10 years from now?
Yeah, I think 10 years from now, it becomes in some sense really very, very ubiquitous, right? Even more ubiquitous than it is today, where we're starting to see it not just in watches or in things like these card readers like Heartbeam has, for example, but literally into biofabrics and things like that, right? Where you are your heart rate, your electrical signal is being monitored in an ambient way on a more continuous basis. The technology to do that is to some degree already there, but it isn't yet ubiquitous to the degree that it can be. It has started to become ubiquitous from a smartwatch perspective, but it can go way beyond that in terms of modalities. So I think that will be critical. The other thing that's going to be critical is to go through the regulatory clearance processes for each of these conditions, right? So for example, when we spoke about the 600 different conditions that were profiled by Mass General, unlike blood, for example, where this has been established over a period of time where you can do blood tests for various things. For each different condition, you have to go through, prove efficacy, prove the right level of sensitivity, specificity, PPV, do either retrospective studies, prospective studies, and get that clearance. And that process is not overnight. Frankly speaking, it probably takes, maybe 2 quarters, let's say, to build a good algorithm. It probably takes many multiples of that, based on our experience at least, to get the clearance needed to then deploy it into existing workflows, right? So that whole process is just honestly time consuming, and for good reason. You have to prove efficacy in an area where it hasn't been used before, right? So even in our context of hypokalemia, where we work with a lead 1 device, we have to prove efficacy before the FDA approves it. They've given us a breakthrough. They're working with us to make our path to clearance easier, but we still have to do what we need to do to get to that point. So in 10 years' time, our hope really is that a lot of these algorithms are cleared and can be deployed in the field and become very useful. So I think clearance is a big aspect, and the regulatory aspect is really important. Alongside that, the hardware becoming more ubiquitous is very important. And one of the other major things is just having as part of integrated clinical workflows, right? Because to be very honest, health systems right now are inundated globally, right? There's just a shortage of clinicians around the world. You take a look at, cardiology, for example. I think in the UK, where I am right now, the ratio of people to cardiologists is something like 1:20,000. That number increases to 1:100,000 in the US. In the US, there are essentially cardiology deserts, counties around counties where there are no cardiologists. So how do you get to those counties, and how do you monitor these people when they are remote? Having technology like this can definitely enable that, but it has to integrate into existing workflows in a way that doesn't add to the burden of the clinicians. So I think that is going to be extremely important as well. But really, the hope is in 10 years, all these three things come together: the ubiquity of the hardware, alongside the regulatory clearances that are needed for people to feel comfortable that, at a minimum, some of these algorithms can be used as screening tools, even if they're not final diagnostics. So you can identify who needs treatment faster, whether they're in remote Arkansas or they're in New York City, right? Or honestly, anywhere in the world, because this particular ubiquity is not going to be just limited to the US. And then the third piece, of course, is having the workflow integrated model where you're not burdening the system more than it's already burdened.
Well, definitely, man. That's an amazing world I hope we all enter into in the next 5 or 10 years, and is providing healthcare to a lot of people that can't really have it in the most efficient manner. But Sadiq, it was a pleasure chatting with you today, and we look forward to hearing even bigger things from your organization over the next coming years.
Thank you. We're excited as well. Thank you for the questions. They were really good. Thank you.
Oh, no problem. Everyone have a wonderful day.
Just another phenomenal interview. Brian, thank you for facilitating that. And again, Sadiq, phenomenal to hear what's going on with Accucardia. Looking forward to seeing that technology breaking barriers around the world and around certainly the US in terms of being able to identify patients and populations at risk much more efficiently, and getting them into interventions much more quickly to save lives and improve health span around the world. This is great. We've got a lot to do still in our final hour. We are in hour number 3 for today's April's Digital Health Symposium on breaking barriers for health access. And our next topic and duo for discussing an important topic here around being able to quantify the return on investment for digital health and healthcare around AI, both the challenges and the approaches that people are taking to do that. Again, we have our own Amy West, the Principal of Advisory Services at HITLAB, and she'll be talking to Padma from Bayer. And Padma is with the Global Product Management team, where she's a director and doing some very impressive work with Bayer on AKA Bayer for Americans, on what's going on within the overall health ecosystem around digital. And handing it over to Amy. Amy, the floor is yours.
Thank you so much. And welcome, Padma. It's really a pleasure to be able to speak with you this afternoon. And as Stan mentioned, we're going to be talking about quantifying the ROI in the digital health space. And so before we jump into that, though, I think it'd be great if you could share a little bit about your background and what you're doing at Bayer.
Sure, I would be happy to. Hi, everyone. I'm Padma Yodhimari. I'm a software engineer by training. That's how I started in my career. But for the past 20 years, I've been working at the intersection of technology and healthcare. 15 years of that was at United Health Group on the payer side, and 5 years at Bayer in the digital health solution business. At Bayer, I have and continue to have the opportunity to work with an amazing team to build a digital health product for hospitals, healthcare institutions. It's a platform for AI applications for radiology. Throughout my career, I've been aware of the complexity of our US healthcare system and various stakeholders having different incentives. But it was not until my current role where I became acutely aware of how much this impacts and informs product strategy. So for my example of this radiology platform, we have several different stakeholders. If you think of a hospital system, the purchasing is informed by different departments. So we have our actual day-to-day users are radiologists, but they have other users, like the radiologists write to report and provide information to the clinicians who either order the tests or their emergency department where you get patients coming in for, say, stroke triage analysis. And then you have the actual patients themselves. But when you take the hospital system, you have the chief technology officer who wants to make sure that you have a software that is easy to install, implement, maintain, and is secure. So they do have different incentives and they're looking for different ROIs for the product. And then you have the providers themselves, right? They have different incentives. They want to make sure they can provide the best care for the patient without any interruption to their workflow, their clinical workflow, and without unnecessary documentation and burden. And then you have the hospital system itself where they need to stay afloat. They need to make sure they invest in the right technology that can help them provide quality outcome to the patient population while controlling costs and being profitable. Especially when you see that there are some community hospitals and smaller hospitals that are going bankrupt. This becomes very critical for them that ROI is an important factor in making any decisions they make for software. And again, there are disincentives also, right? In adoption, when you look at it, where the hospital may be providing a certain service that is bringing them revenue, whereas a digital health innovation might be taking away that revenue by adopting that, right? So they do have to balance the needs of how this is going to work in the overall economic landscape of that particular solution that we are looking to adopt and for the ROI. So it's a very tricky situation. And then when you look at payers, right, and payers are key stakeholders, and this is unique in the business world. If typically a product is being sold by one company to one user, right, who is using it and paying for it. But in healthcare, the payers are hidden behind different layers, right? Patient may have some copay or other costs, but then the main payers are either the government, say taken Medicare or Medicaid, or you have the employers who are self-funding for their employee population. And then you have the self-funded health insurance companies. And generally, the incentive is to purchase products that provide the most quality for the least cost. But specifically, each of these payers have their own incentives and ROI that they're looking for, right? Health insurance companies, they want to make sure they have utilization management and they get quality ratings, right, for maintaining some of the Medicare and Medicaid payments. Employers are looking for predictable healthcare costs because their CFOs need to put aside a certain amount of money for every year for their patient population, for their employee population. And for them, the main motivation is business continuity. How do I ensure that I reduce absenteeism and we can have better outcomes? Hospital systems, as we said, want to be profitable. And at the heart of all is the patient, right, who wants a certain health outcome that they want to achieve. And they want to be able to access it and afford it. And so that is their main incentive or the ROI on that is how can I achieve this health outcome in a way that I don't go bankrupt. And so that's the incentives that you see and ROI that's needed to be proven for each of those stakeholders.
Well, thanks for sharing that overview. It's clearly a very complex consideration set. And so when you're thinking, in the product development space and the work that you're doing with all the different stakeholders, the payers, providers, the end user patient, the caregivers, how do you prioritize, what the value is to them and what their ROI is? Because, ROI doesn't necessarily have to be a dollar amount. It could be an experience or some other form of return that has value. So how do you, across the different stakeholders, how are you sort of prioritizing those different areas of value?
It's a great question, Amy. And if you think about, and you said rightly about incentives, not all of them can be quantified in terms of dollars or health outcomes. When you think of, the professions that have the highest suicide rates, doctors are the professions that have the highest suicide rates and the highest moral injury, right? So not everything can be, and the value of these providers and clinicians who provide to the society is very high. So the value, as you said, is not necessarily can be measured in terms of, X amount of hours saved, so many dollars saved, or so many procedures avoided. It's about, how much are you reducing burnout? What's the, like an employee satisfaction score for hospitals, for how their providers, what's their well-being? And same thing for the patients, right? What's their quality of life? So there are so many other things that are intangible here. But I think there are also, ways that you can even talk about that intangible and ways. And when it comes to prioritization, right, I think the one of the critical tasks of a product management is to prioritize, right? We call that ruthless prioritization, and we always have, a lot of things that we want to build, but at the same time, we need to balance that with what is going to give us the maximum value, commercial value, right? I mean, there could be a value that we could be providing to a patient, but then as a business, it has to be balanced with what is commercially viable, right? So when you're doing that, it is important to look at the stakeholders and what is the ROI that they're looking for. So for example, one approach to take that is to take a minimum value proposition exercise. A minimum value proposition is defined as the simplest version of a product that still provides value to the customer and validates the core assumptions. And each of these stakeholders would have a minimum value proposition, right? Because that's what shows that it provides value to them. And when you do these minimum value proposition exercises for multiple stakeholders and you put them all together, you can identify where you have the most overlap, right? And that is your priority. And that says, okay, this is the set of activities and features that I'm going to build for my product that's going to help provide the most value for multiple stakeholders and prove my product concept. If it's an initial stage or if you're ongoing and going to create more value through your product.
I think that's a great example of how you look at all the different stakeholders and what they're valuing, and how do you then ensure that you are delivering something that is going to work for the most number of stakeholders while also ensuring that you're delivering for the company that you're working for as well. So you've got to kind of balance those things. I think that makes a lot of sense. Can you talk a little bit about ROI and benefit from a data and insight standpoint? We talked a little bit about, ROI isn't necessarily just about revenue. It could be reducing absenteeism and burnout, delivering better outcomes and better experiences. But from a data and insight standpoint, can you talk a little bit about how you can evaluate ROI from that standpoint?
Yes, I think what happens is most people are, when you want to solve a problem, you're really focused on what technology can I use to solve the problem and the product. And what we fail to see is that how are we going to demonstrate value to the person who's going to actually buy that, right? So I would say that, you have to look at where is the unit of value that is being consumed. At that point, what is the measure of that value? If it is measurable. It could be as simple as, as an automated prescription refill, right? The unit of value there is a time saved by the user. It's easily measurable at that point that, okay, the time it takes for you to go to a pharmacy, stand in line and get a prescription, whereas you have an automated refill that's even that's get delivered to your door. And that's an easily trackable quantity that you could do. The most difficult to track is the outcomes, right? But what happens when you have better adherence to the treatment? And here the value to the payer is the adherence to the treatment by having this automated prescription refill feature, right? Because now it says, now the patient is always getting their steady supply of medicine. So we can have those treatment adherence, because that's an important factor that we see in the healthcare landscape today, where patients are not adhering to treatment that could lead to more hospitalization. And so those are the types of value that at the point of consumption of the value, you track it and put that in a way that is consumable for the respective stakeholders. And I would give an example of, say, for example, you have an Aura Ring-like product that is going to measure your sleep and other biometrics. And you want to make sure that you are providing, you provide the user with the charts and values and insights, right? So that's a more straightforward thing that you're saying, okay, here's your value. By doing this, you're able to find out, that you don't sleep well on these days, right? Or your oxygen level dropped on these days. And so you're showing the value to them ROI on a continuous basis. And it is important because it is from an engineering perspective, it becomes a very important decision of how you're going to store the data and how are you going to present the data, right? Because it's also like when you go to a grocery store and you have a checkout and they say, okay, you saved $25 today, right? By using your store card or whatever. So the value is being reinforced, right? So it's also talking about, okay, where am I going to track it, save it, and make it available to the stakeholders in a way that will make them want to continue to use your product, and it drives the value proposition home.
Yeah, that's great. And I think another good example, and you also shared a nice example earlier about when looking to prioritize the MVP approach that you use. Are there any other best practices you could share relative to making sure that as you're developing products, you are clearly thinking about the value to the end users or the intermediaries that will have to be involved to make sure that you're developing a solution that is truly solving for a real problem and not the other way around?
Yeah, so I was going to talk about the MSK offering, right? I think if some of you have already used these digital physical therapy offerings, these are offered by employers through your health plan. And I think it's a great example because the MVP there is, the service, from a patient's perspective, they want to make sure that there is a service equivalent to going to an inpatient physical therapist, right? Because when I go inpatient to a physical therapist, I know that that person's going to make sure I'm doing it the right way. And that would then lead me to, do things the correct way and then get better and reduce pain. And then for the employer, they want to have the same service equivalence because that is, and they want it to be scalable, available at a lower cost. And they want proof that it can reduce, say, absenteeism, and there is patient adoption and adherence, right? So you have these two MVPs, and the service equivalence is the common factor between the two in this example, right? So in this case, building a feature that tracks the patient's motion as you're doing the prescribed exercise through a camera, either the patient's own or the company provides it, it can help reinforce the value proposition to both the patient and the employer who's paying for it, right? Because the patient is now saying, okay, now I'm getting this something that's equivalent to being there because a machine is actually giving me feedback in real time. And then, you get the adherence information, right? And you can track that insight and provide that to the employer to say, for 90% of the time, every patient is able to follow along and do this the right way. And so, you're getting this. And there's so many other metrics that they could be reporting on. But that's one example that I would talk about, that, it kind of, you building the right product and the right feature that and that incorporates the ROI and usability into the same concept.
Well, I think that's you've shared a number of really great examples and best practices that I think at the end of the day really tell the story of, as you are in the product development space, making sure that you are solving for the right problems, with the stakeholders, and having them part of that process and understanding what is of value to them, and then developing for their needs as a way to really, help better ensure the success of and the outcome that you're looking for. Well, Padma, thank you so much for your time. It was a pleasure talking with you. You're clearly an expert in the space, and hope to be able to speak to you again. I think your knowledge has been very valuable to our audience here. So thank you so much for your time.
Thank you, Amy. I appreciate the opportunity to share my knowledge. Have a good day, everyone.
Take care.
Thanks.
Fantastic. What an interview. And next up, Amy is on again, and she's going to be talking with the team from Actual Healthcare Solutions, which is revolutionizing how physicians share data between primaries and specialists, and how patients, again, talking about breaking barriers, how that data sharing improves clinical outcomes and enhances physician practice revenue. Handing it back over to Amy.
So thanks very much. In this session, we're going to be talking with Jim Payne and Robert Holton. And our topic now is AI impact and the road ahead inside Actual Healthcare Solutions, healthcare revolution. So welcome, Jim and Robert.
Hey, Amy, how are you doing?
I'm doing well. How are you guys doing?
I'm
doing
good.
Great. Yeah, doing great, Amy. Thanks for having us.
Absolutely. And so before we jump into the topic, I'd love for you to give just a brief background on yourselves, and we'll jump into the work that you're doing at AHS.
Take it
Sure,
away,
go ahead,
Rob.
Jim. You can, sure. So I'm Rob Holton. I'm president and COO of Actual Healthcare Solutions. By background, spent first 10 years in venture capital and spent the last 20 as an operating executive in healthcare technology companies, early stage to mid-stage hypergrowth companies. And that's been my passion for the last 25 years. I've been with Actual Healthcare Solutions now a little bit over a year.
My name is Jim Payne. I'm a retired broadcast journalist, 44 years in the business. I come at this as sort of an everyman, and the founder of AHS, Dr. Jamie Wisser, is my longest best friend. And he came to me with a problem that he had been dealing with, or actually multiple problems in his practice, and said, I have an idea. And I think I want to start a company, and would you like to get on board? And I was like, yes, absolutely. And so I guess I'm one of the original gangsters here, and really happy to be on board.
Well, it's nice to see you both. I believe we caught up at the December summit, so it's nice to see you again. And for those in the audience who might not be familiar with Actual Healthcare Solutions and what your mission is, and your role in health IT, can you share a little background on exactly what you do and what your mission is?
Sure, absolutely. I'd be happy to. So, look, time matters in healthcare, right? To be completely cliche, and delays in healthcare, in their best case scenarios, degrade healthcare outcomes. In the worst case scenarios, delays can be deadly, right? And no more so than in specialty care, whether those delays are at the primary care physician's office trying to find the right specialist, or the delay in getting in to see that specialist, and assuming that the specialist is going to take on the patient, which, by the way, is a big assumption, Delays in getting to diagnosis, and that can be at radiology, right? Delays in scheduling at radiology centers, getting the results back, the actual images from radiology, getting interpretations, right, from radiologist reports. There's delays there, all the way down the line. And as those delays compound, right, they continue to degrade healthcare outcomes substantially. And that's where actual healthcare solution comes in, right? The actual healthcare solutions substantially accelerates the time to clinical and definitive operative care. And whether that is starting at the primary care physician's office, helping identify the right specialist, going really accelerating the entire process through to surgical intervention and actually into the surgical suite itself. And then also kind of closing the loop back to the primary care physician, right? And when we do that successfully, we are able to have a substantial impact on healthcare outcomes through the acceleration of critical care, but also have a fundamental impact on the economics of the underlying health systems and medical practices, both from a cost-saving standpoint as well as from an economic standpoint, both revenue generation and profitability enhancement.
Yeah, and if I could just follow up real quick, Rob. Jamie, Dr. Wisser, I remember him sitting in my living room one day and talking about his practice and the frustration that he felt. I mean, we're all patients. And so we know what it's like to go in for a physical, and the doctor has their face buried into a laptop and they barely make eye contact, and they write you a script, and it's on you to find a specialist, perhaps. And he was just frustrated from not only the caregiver standpoint, but all across the board, and thought about it and bounced ideas off of people and came up with this idea that is actual healthcare solutions. And once he got a hold of it, he never really let it go. And in time has surrounded himself with enough people to make this vision a reality. And Rob, it's not like he just latched onto one idea. He listened to people and he pivoted when we needed to make pivots and wasn't completely beholden to that original thought.
Yeah, I mean, I think I think that there are, I think that what you just shared is really interesting because there are so many hurdles that we face in healthcare. And obviously you're looking to solve some of the access and trying to accelerate people getting the help that they need as quickly as possible. And also being a startup, there are hurdles with healthcare, there are hurdles with startups. As you're looking to continue to grow and scale your organization and the work that you're doing, what are some of the biggest challenges as AHS what have you faced, and what are some of the biggest challenges that you're seeing as you're looking to scale the offering?
Yeah, I think, Amy, look, there's a set of hurdles that every startup, regardless of industry, faces, right? And we don't need to kind of delve into those, but I think there's a set of unique circumstances in healthcare and hurdles, especially for an early stage company in AI in general, right? And so to kind of look at those hurdles, let's keep it really simple at the top level. I'm going to break AI into two buckets, right? And just so I don't get hammered on LinkedIn and Twitter for oversimplifying AI, this is for like example purposes, right? But if we think about AI in healthcare in two different buckets, one is from like a workflow standpoint, right? Think of AI being helping with prior authorizations and bill codes and CPT codes and so forth, right? The actual workflow of healthcare, right? And then there's the second part of AI, which is the clinical AI that's actually part of either clinical decision support that's actually interacting with healthcare decisions, right? So if you bifurcate those, if we talked 2 years ago, AI in general, people were kind of like, yeah, we don't we don't want it, that it's something that's new. Look, AI, the unique thing about AI is the ability, always outpaces the adoption, right? And so how do we look at that? The good news is if you look at those two buckets, right, kind of the workflow bucket is really started to be accepted across the board in healthcare. And so one of the things as you penetrate the market is can you anchor part of your product in that acceptable workflow, and almost uses a Trojan horse, right, to get into the clinical side if you so choose. Because there's some robust products out there. AHS has done that. But the harder and the bigger hurdle really is on the clinical AI, right? And I think as we've progressed and brought clients on board and been through sales calls ad nauseum, I think the really two biggest pushbacks that we see, right, from the clinical AI component, one is half the population says, I don't trust it, I don't believe it, you can't take the human out of healthcare. I agree with that, by the way, as does AHS. We're never looking for AI to take it out of healthcare. The other component is they're fully bought in and saying, yeah, but AI is changing so rapidly. Next month I'm going to sign this big long contract. Next month there's going to be a better AI, and it's like analysis paralysis. And so these are hurdles. How do you handle these? Right, from AHS, the way that we've looked at it is we've never seen AI as a tool to replace humans. Whether we're using AI to generate, we're integrated with EMRs, whether we're using the AI to generate clinical summaries of the patient, whether we're doing, ambient dictation, transcription, and automatic SOAP note generation, or whether we're using our AI in radiology. We're not looking to replace that radiologist, right? What we're looking to do is accelerate the time to care so that they can continue the care path, as they're waiting for the declarative answer from the human, right? But I think the bigger question is the analysis paralysis, right? The way that AHS has dealt with this is that we don't build our own AI from scratch. We take the best AI, medical grade AI that's out in the market, we'll train it, we'll adapt it, and we'll put it into our platform. But our commitment to our clients is you will have the best AI in the marketplace with AHS. So next month, if a new radiology or a new oncology AI comes out, for us, it's simply buying the license, incorporating it into our platform, and pushing it out. So we're removing two of the biggest hurdles of AI adoption and taking them to and putting them to our advantage.
Well, I think that's great. And I also think it's really, it's so important to understand what these hurdles are so that you can be prepared to address them and overcome them, which clearly you are doing. So that's really critically important to capture that feedback from the different organizations you're talking to, take that to heart, and then know how to address it so that they no longer become hurdles for you. So that's a great example. And as we close out, I'd like to ask, where do you see the biggest opportunities for AHS to make lasting impact on our healthcare ecosystem, especially as we're seeing AI adoption continue to grow?
Yeah, great question. I think, long term, to me, I've always looked at healthcare, and AI can play such a huge component in this. We see data is critical, right? And we see these silos. We've got the healthcare system silo of all of the data, right? And they're trapped in their EMRs, right? And then you've got all of this data that resides at the payers, right? And that data points, are siloed, and we've done work, the industry, to be able to go back and forth. But there's another side of the data silo that's critically important to healthcare outcomes, and that's the patient-generated data, right? And quite frankly, it's coming, from a lot of the apps and programs that insurance carriers are including in the benefit plan. But that data is siloed off from the people that actually need the data, which is the healthcare professionals. And I think if you can bridge that divide, and that's what AHS is working to in the next kind of iteration approach, if you can bridge that data gap with AI and be able to not only access the data on the consumer side, right, and the insurance side, but synthesize it, integrate it into the EMRs of your providers, and provide it so that it's a meaningful structured data that they can actually utilize as part of the treatment protocol. I think that's the next great utopia in healthcare, and AI is going to play a critical component of that because of just the sheer mass of data.
Yeah, and bringing all those data pieces together for the right decision making, the right actions to be taking, so that we can support the right diagnosis, intervention, and or therapeutic course is key. So I think that makes a lot of sense, and I love the way you are leveraging AI in this much needed space. And would just like to say thank you both, Jim and Robert, for joining the conversation today, and wish you continued success in this journey. So thanks so much for your time. And
thanks, Amy. Thanks for having us. We appreciate it.
Yeah, thanks, Amy. Good seeing you again.
You too.
Outstanding. Well, thank you, Amy, for another great interview. Again, for our audience, we're looking at a number of different ways where digital can break those barriers between access and quality and affordability. And I think that we're seeing those now, not just in terms of some of the apps and some of the wearables, but also in terms of some of the infrastructure, like we're seeing with actual health services, and certainly the folks from the Proficient Labs. And next up, we have Amy. She'll be talking to the team from Recovery Plus. And Recovery Plus, they'll talk more about their model in a minute, but this is one of the revolutionary digital models that allows people to be able to rehab at home. And I think that's what everyone would want to do. And that's what certainly Peter and his team have done with, and Ashley and Jenny will talk more about that with Amy now. Back to you, Amy.
Thanks, Dan, and welcome, Ashley and Jenny. We're going to be talking about improving access to cardiac rehabilitation and chronic care management through digital health. And as Dan mentioned, Ashley and Jenny are with Recovery Plus. So welcome, and thanks for your time to join us today. To kick it off, I would love to give you both an opportunity just to give a quick intro, and then we can jump into the topic.
Yes, hi. So I'm Jenny Martin. I am the Chief Nursing Officer with Recovery Plus. I have actually been with Recovery Plus for about 7.5, 8 years. My background is fairly targeted with being in cardiac rehab, pulmonary rehab, as a nurse practitioner and a nurse over the last about 10 to 12 years. And so Ashley, I'll go ahead and let you introduce yourself.
Hi, I'm Ashley. I am an occupational therapist. I've worked pretty much across the continuum of care, inpatient, outpatient, ICU, CDU, you name it, and joined Recovery Plus about a year and a half ago at this point as the VP of Partnerships. So yeah, Recovery Plus we are a chronic care management, remote patient monitoring, and cardiac rehab company. As Dan mentioned, we are providing all those services right from the comfort of the patient's home. So it includes one-on-one exercise sessions, one-on-one dietary consults, one-on-one care and treatment with APP. So as Jenny mentioned, nurse practitioners, PAs, you name it. So really focusing on increasing access to care and providing patients with a comprehensive program that they can do all of their rehab, preventive care, maintenance care right from the comfort of their home.
That's fantastic, and I think it's really an amazing trend that I hope to see continue to boom. So for this topic, let's start a little bit with the big picture and the why of this and the problem to solve. What gaps do you both see in today's cardiac rehab and chronic care models that digital health can help fill in a very unique way?
Yeah, absolutely. So we know that cardiac rehab works. We know it's efficient. We know it's effective. We know it keeps patients out of the hospital, preventing hospital readmission rates. But it is wildly underutilized. So about 80% or so of individuals who are eligible for cardiac rehab do not go. And there's a number of reasons why they don't go. There are personal reasons. There's obviously barriers to care, ranging from geographic location. So if they're in a very rural area, there may not be a cardiac rehab nearby, or it might be a transportation issue. But even for those in an urban area, there's often limitations due to number of facilities or significant wait lists. We found that even here in New York, there's a number of cardiac rehabs, the wait list can be up to 2 months. And with that, of course, comes like time constraints, financial constraints of even simply the cost of getting there, but also having to take off work to go to cardiac rehab 3 days a week, drive there, participate, drive home, child's care, whatever it may be. So geography, time, financial, and even eligibility criteria, right? So there's only a few diagnosis codes that are accepted to cardiac rehab. So that is another significant barrier. And digital health really allows us to increase access to care, addressing all of those barriers by bringing the care directly to the patient's home. And then from the chronic care management standpoint, it opens the door for individuals that haven't necessarily had a cardiac event, but have the risk factors like hypertension, diabetes, obesity. So getting them in the door, even though it's called chronic care management, it is serving that preventative care in order to prevent future complications down the line. And the digital health further helps us get it in a timely manner and get patients off of the right track.
Yeah, that's great. I mean, because there is a real need out there that goes beyond just cost and access. It's
Absolutely.
life getting in the way of being able to actually get to a place where you can get the rehab. And it's great to have this opportunity that we have with technology and digital to help, bridge some of those gaps and some of those challenge areas. And from like a clinical perspective in the work that you both are doing, how has remote patient monitoring changed the way that you're providing care?
So I feel like from a clinical perspective, one of the things that it has done is allowed us to take a more proactive approach. And it's actually a data-driven proactive approach. So we're able to utilize cellular devices like a blood pressure machine, weight scales, and these give us real-time data. So with this, we can intervene much quicker. So it kind of takes away that, are they really weighing? Are they really checking their blood pressure? Did they tell me this number from 3 days ago? So we're actually able to intervene much quicker. We're able to sometimes intervene at home, primary care office, cardiology office. We can actually enhance medication compliance, because if we do see a slightly elevated number, which is much more rapid than if we wait till they come back into the office, we can start looking at, did you take your meds? Do we need to increase? Are you having trouble with access to getting your meds? Because of all of this, from a clinical standpoint, we actually are reducing overall healthcare cost. And when we look at that long term, it's reducing the burden on the system, whether that be rural health and the limit to care. There's, wait times for even just primary care offices in rural health settings are sometimes 6 months. So we're able to reduce that burden on the system because we're able to monitor real-time data.
Well, those are very important impacts, and people really are always looking at those costs. So I think it's a really important point and a great opportunity. As we talk about, the clinical perspectives and the technological opportunities, we don't want to forget about the fact that these things together are really about improving a human being's life and outcome and quality of life and ability to live their lives the way they want to. It's about that patient experience. So based on the work that you're doing, by leveraging these sort of digital technology strategies in the home, how are you seeing that impact the human experience? And are you seeing an improved experience, a more engaged patient with the approach that you're taking?
Yeah, absolutely. And I think, it's pretty basic, right? I feel like one of the strategies that we've really utilized and really, really find great value in is just simply building the trust. Our healthcare system is so incredibly complex. It is so confusing. There's so much out there, whether it be providers, even digital health companies. Like, what sets you apart? What makes a patient trust you versus like logging onto an app and then using it for 2 weeks and then being done with it? So I would say that building the trust not only amongst the patients, but amongst the providers as well is really essential. Once a provider knows that we're providing comprehensive care that they trust, and they can talk to the patient about it. That is definitely the first step. And then the second step is really showing the patient that we're there for them, we hear them, we're listening to them, and being able to build that trust and build that rapport. We're able to show them that, like, we can consistently give you value through this personalized care. So not just showing them that we know what we're doing, but showing them that we're listening and that we're adapting the program based on their needs every time we see them. So our patients are getting consistent exercise physiologists, dietitians that are doing their initial evaluation, setting up a plan for them, modifying it as they need, to really ensure that we're, holding them accountable, but we're also providing them consistent value, personalized care throughout their duration of their time on the program. And then from, I would say, like a digital health perspective of a strategy is, again, pretty basic, but ensuring ease of use, right? Nothing complex, intuitive design of the apps or of the tools that they're using, and also integrating it with like familiar devices. So a lot of patients are already using the cell phone that they have, or an iPad or a computer. Like Jenny mentioned, we provide all of our patients with blood pressure cuffs, and they're simple. There's one button, it's cellular. All they have to do is put on their arm and press start. And the information is automatically uploaded to our system. So ease of use, I think, is definitely an important strategy just to ensure compliance and keeping it, like we said before, easy, part of their day-to-day, and supporting it and falling into their habits and their routines, not just a random pop-in or that they're just opening the app. So we're there for them, they trust us, and it's easy.
Yeah, I agree. I mean, I think anything where, you be where they are and make it as easy for them, give them the easy button is really the sweet spot. But then that personalized adjustment makes the individual feel listened to and heard, and gets them more, more engaged, more willing to really be a part of the work that needs to be done as a part of the program. So I think that's a great way to think about it and deliver it. So as we close out and you think about the work that you're doing in the space, in the cardiac rehab space, this question is for both of you. If you each had like a magic wand, what's one barrier that you'd remove to accelerate digital transformation in this cardiac rehab space? And what excites you about the future of digital health in chronic care management?
Yeah, so I'll start on this one, Ashley. So the magic wand. I love this question. If I had a magic wand, the barrier I would remove to be able to accelerate this digital transformation in cardiac rehab would 100% be the limited and inconsistent coverage of chronic care management services and cardiac rehab services by insurance. So we've seen the evidence. We know that these rehab programs are improving patient outcomes. We know that chronic care management is reducing hospital readmissions. We know it's lowering those long-term healthcare costs. However, we are still having some insurances that just are not providing adequate reimbursement, or occasionally no reimbursement. And that is where, if I could just wave the wand and make that barrier go away, I would. We know if we could just mandate comprehensive insurance coverage for in-person digital rehab and chronic care management, we know that we could dramatically expand the access to these services, specifically for underserved areas, rural populations, and our patient population that doesn't have access to transportation. It would incentivize providers to go ahead and adopt these digital scale solutions. And then it would enable more personalized data-driven care. So overall, that is what I would definitely improve.
And that makes a lot of sense. And Ashley, like, what's exciting you when you think about the future relative to digital health and the work that you're doing in the rehab space?
Yeah, I think Jenny touched on this a bit before, but utilizing the data from the remote patient monitoring to create personalized care while also increasing the access to that care. So I mean, I guess it's really just expanding the access, it's patients that are in these like rural areas. It's not that they, that this is an option. It's like it's for many of them, it's the only option. So not only getting out there, but getting them personalized care. And I think, really focusing also on that seamless like integration from a digital health perspective with other care teams to make it a collaborative approach. So getting patients in rural areas the care that they need, making sure it's personalized, but also still keeping in mind that, these patients came from a primary care physician, they came from a specialist, and using the digital health tech platforms or providers to really communicate what is going on with this patient so we can work it as a collaborative method to really cover all the bases.
Well, I think those are great things that I hope we are going to see in a not too distant future. But in the meantime, thank you so much for the work you're doing in this important space and really delivering a very customer-centric, patient-centric approach to healthcare, leveraging technology and digital health. So I think it's a great case study. So congrats on all your success and thank you so much. Would love to talk with you again sometime. But Jenny and Ashley, have a wonderful afternoon. Thank you so much.
Thank you. Thanks, Amy. Have a good day.
Thank you, Amy, for another great interview. Just an incredible whirlwind of the April Symposium. And there's nothing like just a bevy of experts like we've seen today to really come in and help open our eyes about how digital health is a lot more than apps and devices. It's a lot more than even AI. It's a whole slew, an entire army of infrastructure and lab management systems and different types of patient connectivity systems that are helping change the way medicine is delivered to patients, the way medicine is created by life science companies, and the way medicine is actually reimbursed and triaged through hospital systems. Now, don't forget to be a part of the HITLAB Summit coming up May 6, 7, 8. You've heard it several times over the last few hours. We are so excited to gather everybody together, about 300 of your closest friends, colleagues, coworkers, subject matter experts, startups, investors, payers, providers, pharma, etc. And we're really looking forward to seeing you guys. And in case you can't make the summit, then definitely sign up and join us for next month's HITLAB Symposium in May. We're going to have, again, another wonderful group of healthcare experts from Dan Kagan from DLA Piper, one of the leading groups out there helping people put together their whether they're financing their companies or they're taking them public or whatever it might be. DLA Piper is the firm to go to. Sally Frank from Microsoft and the Microsoft for Startups. She's the global lead for them, doing an incredible job helping companies like the ones we've seen today, the Proficient Labs, developing on the Azure cloud, et cetera, using the Microsoft tech stack to develop AI, the leading tech stack in the world for that. And then Roshane Sasson from BirthView, developing a leading women's health platform to help new moms make sure that their babies are healthy and that they are healthy through the delivery process and afterwards. And then, of course, Ilker from Pons, another Breakthrough Alliance winner, has been absolutely taking the world by storm with his platform. And so we're very excited to get updates from him and what he's doing. And again, we can't thank the team enough. The people that put this program together for you every month, they are extraordinary. They work hard. They work long days to line up the speakers, oftentimes line up speakers who were replacing speakers who had something come up and they can't do that or something. And then just everything from the show flow and the production that make the things that John and Amy and Bill Toronto and all the other hosts do look so seamless. And again, thank you, Rachel, Ansley, Raymond Pallavi, Melissa, Jerry, Sammy, Nico, Rijo. It's an incredible team. We are so lucky to have them working with us. And you are too, because without this team, you wouldn't be getting this incredible information about how to develop and scale digital health technologies to help improve patient care, healthcare delivery, and life sciences. And finally, our sponsors. Without our sponsors, none of this is happening because people don't work for free, and we need to make sure that what we're doing is sustainable and scalable for our staff. not just in the US, but around the world. And so we can't thank the Merck Global Fund and FFF Enterprises, Information Media Corporation, Microsoft, Helix VM, Fin Partners, and certainly Actual Health Solutions for all the good work that they're doing to help begin to continue this digital transformation in the US free market healthcare system. So as we hit the 2 o'clock mark on the dot, I will bid you all adieu until next month, hopefully at the HITLAB Summit. If not, then we'll see you at the symposium. And in the meantime, everyone, please take good care of yourself and stay healthy. Bye-bye.